I have held the community resource module virtually. So this should be an interesting endeavor, but please bear with us if we have any ins and outs or just kind of the flips and flops that happen time to time. So the community resource module, well, let me introduce myself. I'm Maria Castillo. I'm the community outreach coordinator for Wraparound Milwaukee. Generally, if we were in person, I would be able to meet all of you and see, what agency each of you are from and what it is that you do, how long you've been with us. So I'm hoping that all the information today that you hear of is new to you, or at least clarify some things as to how the community is operating at this time. Typically, this module would have been out in the community, so you would have showed up at Behavioral Health Division, and we would have had you, come in, introduce yourselves, and I would have given you a place to go to, and you would have been like, well, what do you mean I'm going out in the community? And I would have explained to you that the idea of this module is to really know what the community resources are, how to connect families, how do those resources operate, and how can we make the best referral or connection for that family. Really keeping in mind that if we do have families that are out there traveling, whether it's by bus, by car, they're walking, they're taking their bike, or however, being mindful that sometimes families are using their last couple of dollars to use that bus. They're using, they have a couple kids with them, they might have, things that they're carrying. And when they get to a place, especially if they've been in a crisis, they need a place that, you are aware of that resource and that it's the right connection at the right time. The last thing that somebody wants in the middle of a crisis is to show up at a place that they believe that they were going to get help at, and then they weren't able to get it. So keeping that in mind, because what will happen is if a family gets to a resource that you've explained to them and explained to them very, very well, is that they're going to say, you know what, my care coordinator knows what they're talking about. My care coordinator knew the right resource at the right time. You're going to build that trust. It's going to be a great experience for that family. Even though they're in the midst of like whatever it is that they need, that's our job. That's what we do. So kind of keeping that in mind throughout this whole process that, the community is not shut down, and it is our job to connect families to those community resources. So definitely, I hope you enjoy this module. We have Dr. Mosio and Dr. Nowak coming to talk about inpatient services. And inpatient services are not a community resource, but the importance of talking about them today is if we're using our community resources wisely, hopefully we can alleviate some of the stress, some of the concerns that families have, that when things do become, heated, or when things do become stressful, that we're not looking at inpatient services or ways to get children and families out of the home, but how can we use the resources to either alleviate some of that stress or plan around some of the crises that happen with our families, because we know that the crises are going to happen. We don't always know when they're going to happen, but even like right now, like I have one child at home and sometimes I like to send her somewhere. It's the teenager in her, right? So, but I wouldn't like go that distance, right? But how do we help build in like those moments of respite for families? How do we build in those moments where we can help them get through the struggles that they're having, so that the response to that stress or that struggle is something that is manageable and is something that they can get through and they know what that plan is. So, Dr. Nowak, did you want to say a couple things before we get started?
No, I think that's a pretty good summary. I know Dr. Moiseo is meant to be joining us, but we also have staffing going on right now, so I'm not entirely sure when he'll be joining us. Okay. But he and I have given this presentation a few times. This is our first time doing it virtually, and our first time doing it post-COVID. So some of the information has changed a touch as we have had to adjust to COVID, as the rest of the world has had to do. Yeah, I think we provide this information so that you all will have a guideline of what to expect if a youth that you're caring for is placed with us, because it just sort of helps to have that crosswalk and that sort of game plan ahead of time of what to expect, who you're going to hear from, how the process is going to go down.
Okay. Does anyone have any questions about today? All right. Definitely feel free to use your chat option or raise your hand if you have a question for a presenter. I will be monitoring the chat as well as hands. So if the presenter maybe doesn't see it, I can definitely call it out. So if you have any questions, just let us know. Dr.
And
Nowak?
I am gonna share my screen with the PowerPoint. So yeah, I won't be able to see anything that pops up in the chat.
All right.
Are we good to go?
Yes, please.
Awesome. Okay. Hold on here. I can do this. I know how this works. Yes, I do. Share. No, not that. Sorry. Wrong share.
Oh, we see your email.
Yeah, that's not what I was trying to share. Sorry.
Okay. No problem.
Moved on me. All right. Do you have a PowerPoint?
Yes.
Groovy. So, yeah, and I assume that whenever Dr. Moisio jumps in, he may jump in. But so I'm Dr. Nowak Haggis. I am the psychologist who works on the child and adolescent unit. Been there for a few years now, and Dr. Moisio is a psychiatrist, and he is our medical director. So he sort of oversees the whole shebang. And yes, we put this presentation together because we really wanted to make sure that you all had that roadmap ahead of time, so you could know what to expect if your youth are ever placed with us. So this is sort of the quick and dirty version. And then I believe also within the PowerPoint, I have like phone numbers and things like that if you have follow-up questions. So just briefly, the case unit, as we call it, we are sort of the primary inpatient behavioral health hospital that serves wraparound. We also serve a good number of the community that aren't involved in wraparound, but we are specifically geared with wraparound as a public inpatient hospital. So like WRAP, we're part of the Milwaukee County Behavioral Health Division, and we are very much focused on being an acute stabilization unit. And I'm going to talk a little bit about what that means shortly. We have a wide variety of inpatient staff, including nurses and the psychiatrists, psychologists, social workers, OT, music therapists, APNPs. We have psych techs. We have dietary. So we have like a wide variety of folks on an inpatient services standpoint. It's always helpful to sort of talk about why CASE is different than some of the private hospitals that you all or perhaps the families that you serve may have come in contact with before. So by private hospitals, I mean like Rogers and Aurora, right? Those are the two systems in the area that people are most familiar with. As far as similarities, we all serve individuals that have behavioral and emotional problems that can't stay safe in the community at the moment, and provide a more or less similar level of services while patients are inpatient. The difference, though, and these things I think are very worth knowing, both from your perspective and sort of knowing what families may stumble on or wonder about, is that being a public hospital greatly influences the types of patients that we have at CASE, as opposed to the sorts of patients that more frequently are admitted at, say, Rogers or Aurora. And the reason for that is because being private hospitals, Rogers and Aurora have the ability and capacity to decline patients if they feel they are too acute or they can't manage their needs. Whereas CASE, being a public service, we take everyone. So what that can mean is that sometimes our acuity, as far as the patients that we have, is fairly intense. And some families are and some youth are, especially if they've been through those private systems, sort of unaccustomed to that. Our length of stay is generally a bit shorter than when they stay at Rogers and Aurora. And again, that's because our focus is really on solving the acute crisis as quickly as possible so we can help patients transition back to those outpatient resources that they hopefully have. And we have fewer amenities on CASE just because of being a publicly funded entity. Most kids will tell you anecdotally, and they're not wrong, that the food in CASE is terrible versus Rogers and things like that. We also have this relationship with Wraparound where we are able to work very closely with you guys. Okay, hold on, something was being funny. Where we're able to work very closely with teams and with you all in terms of helping to plan for discharge and providing consultation and sort of a smoother I don't know, work together between the inpatient and the outpatient services. And we have just a sort of a different setup as far as our programming. So we have school that's available and things like that. And the other big difference that is always sort of a major piece of the puzzle is the fact that the great majority of our patients, even on the kids unit, are here on an involuntary basis, which means that they were unsafe in the community and ED'd and sort of brought to us whether they wanted to be or not. Whereas a greater number of the patients that are served at Rogers and Aurora are voluntary. They want to be there. And so that can make for some challenges in terms of providing treatment. And we'll talk about that a little bit too. I include this roadmap because there's sort of a few different steps that people go through in terms of like how they get here. It's not quite so simple as like, oh, so-and-so has done something unsafe and so now they're going to be admitted to the hospital. There's sort of two different routes that patients take to get to us. So they can present voluntarily to our psych crisis services, which is downstairs. If a youth is going to present voluntarily, they must have their parent or guardian with them. It can't be a foster placement. It has to be whoever has actual guardianship of that child. Otherwise, we legally can't assess or treat them, and we certainly cannot admit them. It is important to sort of be aware that if patients are presenting on a voluntary basis, kids who are 14 and older have the right to decline voluntary treatment. So even if the parent, kind of quote unquote drags the kid in kicking and screaming, if that kid is over 14 and says, I don't think there's anything wrong with me, I don't need to be here, and there is no immediate safety reason that would cause us to sort of go over that, we cannot admit them. And they have to be willing to sign themselves in. So that's route one. Route two is that they are brought in on an involuntary basis on an emergency detention, which are initiated by the Milwaukee Police Department. So that happens if someone has a suicide attempt and maybe is seen at Children's Hospital. That happens when families in the heat of an argument have contacted the police and the police arrive and assess that youth is not safe to remain there. But the important thing to keep in mind is that the only people who can legally complete an emergency detention is the Milwaukee Police Department. So if Children's Mobile Crisis is involved in the field or kids are at school or things like that, they have to go through the police department to get that emergency detention, which essentially says, this person is unsafe and we're concerned enough that we think that we need to bring them to the hospital for an evaluation. Once they get to the hospital, they come into what's called PCS or Psych Crisis Services. Once they're in there, they are then evaluated by the nursing staff, by a psychiatrist. They gather insurance information, any collaterals, if they're not present, are contacted. And then based on that evaluation by the psychiatrist, that determines whether or not the patient or the youth is admitted to the inpatient services. So if the doctor decides that the psychiatrist decides that that patient does not meet criteria for admission, the nursing staff and the social worker and the folks in PCS will begin to contact guardians, placements, things like that to make arrangements for them to return. They may also sort of talk about safety planning, helping to connect with community resources, sort of to help bulk up or sort of support, post-crisis. But that won't necessarily lead to an admission, and they'll be looking for someone to essentially come pick up the kid. If the docs downstairs in PCS do feel that the patient meets criteria for admission, they are then either admitted up here by us, on 5-3B, which is the child and adolescent unit, or if they have private insurance, they are maybe transferred to one of those private inpatient hospitals in the area, so Rogers or Aurora. That decision about whether they are admitted here versus other hospitals, again, has to do with insurance and their involvement in wraparound. It has to do with patient preference. It has to do with the behaviors that they may display while they're in psych crisis. So they may not attempt to transfer kids who are aggressive or violent downstairs because they're sort of not appropriate to be transferred at that point. So there's a few different steps. It's like I said, not quite a simple one-to-one of the patient is unsafe and so they are admitted. Let me see, I think I kind of talked about all of this stuff. You all as RAP team members, if you feel that you're working with a youth and feel that that youth is imminently unsafe or dangerous, you yourselves can also contact either the crisis mobile team if it seems like that's something that, or crisis stabilizers if it seems like something that we can try to sort of crisis plan around, or if it seems to you that this is not something that can be safely managed in that moment, you can also request police assistance and sort of ask that they assess the situation for a need for an emergency detention. And then I think I talked about the stuff about voluntary. And yeah, and it bears repeating that if youth arrive to our psych crisis on a voluntary basis, if they're over 14, they must give consent. And we have to have a guardian present. It cannot be a foster parent. It cannot be someone who just has temporary placement of that person. CPS or the legal guardian needs to be present or accessible in order to give consent for that patient to be treated here at the hospital. I think I kind of actually did go over all of this, didn't I? It's been a while since I looked at these slides and actually went through them. When a patient is on an emergency detention, the nurse or the doctor will attempt to contact the witnesses that are listed to try to get a sense from, the adults in the situation as far as what may have happened to bring the child here. They also obviously are interviewing the youth to sort of see their account of things. While they are down in psych crisis, it's the same area that our adult patients come in. However, once they're sort of in psych crisis, we keep the minor patients sort of in a separate room. So we sort of hopefully are minimizing any kind of trauma or anxiety that can come from being around some of our intensely ill adult patients. It's important to know that the patients do have access to a phone while they're in psych crisis. So it's not uncommon that they'll make phone calls to whoever they feel they need to make phone calls to. And then the psychiatrist who is assessing the youth is the one who decides whether or not to admit the patient. And they do that based on a lot of different factors. And generally that includes things like the acute safety concern and the acuity of that safety concern. So like how intense, how problematic, how imminent does it seem to be, whether or not the patient is able to benefit from an inpatient hospitalization, and whether or not the family or team that's available outpatient to the child is able to be activated in order to help them stay safe. Because the goal is to keep kids out of sort of the very sort of limited environment of the inpatient unit, if at all possible. That's why you all exist, right? And now currently when patients are down in psych crisis, they are screened for COVID prior to and during admission, sort of as CDC guidelines dictate. And then if there are any concerns, we're sort of abiding by CDC guidelines and precautions as they apply. Once the patients get admitted upstairs to us, they sort of go through another assessment process that can happen sort of immediately. It can take a few days. It kind of depends on when the patient is admitted. But within that first 8 hours, they are assessed by our nursing. They talk about coping skills. They talk about whether or not the patient wants to accept phone calls or acknowledge they're present to callers that arrive. And they start to discuss kind of the goals and what the patient's perspective is on why they were here. During that initial nursing assessment, they're also assigned a suicide observation status, which speaks to sort of the level of monitoring that we may initiate sort of based on the safety concerns. So right now, patients are either on sort of routine monitoring, or if we have patients who are actively unsafe, or there are concerns for, active aggression or other inappropriate behaviors where we know there's a need for more intensive supervision, even while they're on our locked and safe unit, we may initiate what's called one-to-one monitoring. They're assigned a room. They get a sort of overview of the rules. And then at that point, once they are admitted by the nurse, then the rest of the treatment team comes in to begin their assessment. So those pieces begin kind of on the first full work day after a patient's admission. Like I said, it sort of depends on when a patient comes in, right? So if someone comes in the middle of the night, they probably won't talk to the psychiatrist and the social worker until the following morning. If they come in on a Saturday, they may see some folks on Saturday and Sunday. They may see some other folks on Monday. So it's just sort of when they contact those people sort of depends on when they get in to the building. So we have a number of people on our team. We, of course, have the nurses, and they can be reached by calling the unit directly, and that's the number. So we have a number of sort of different levels of nurses. We have RNs, we have medical APNP folks, we have psych techs who run groups and help with behavior management. These are the folks who really are seeing the day-to-day stuff and are major players in sort of how we're moment to moment helping the youth while they're with us. So they're providing a lot of behavior management. They're providing a lot of the sort of group and interactions. We have some really wonderful nurses over here on case. The psychiatrists are the lead members of the treatment team. So as I mentioned, Dr. Moisio is our medical director. He's a psychiatrist as well, of course. But we have 3 other psychiatrists who work on varying days on the unit. The psychiatrists assess the children daily, and they address the safety issues, they address medications. They'll be coordinating with teams and families about behaviors and medications and how do we discharge and what's needed. They are the ones who are the primary decision makers when it comes to sort of discharge planning and coordinating with the legal department when there is sort of a need to kind of keep the kid longer than we would have, ideally expected or planned for. We have social workers who complete an initial assessment. They are going to be most of the time your primary points of contact in terms of coordinating about placement issues that are coming up, what's going on with guardianship, if there's a need for team meetings, how is the family functioning, how do we plan for discharge. It's important to know that from our standpoint here on the inpatient unit, although our social workers can discuss placement and are going to try to help do what we can to sort of problem solve that issue, we don't have any say in terms of where a child is placed. So, kind of depending on where youth are at within the wraparound system, you guys may or may not. So sometimes that it also involves sort of the involvement of CPS if placement is an issue. And then they help to coordinate the outpatient resources and needs at discharge, which for the case of wraparound, of course, sort of means consulting with you guys and finding out what's currently in place and what's sort of the plan for that youth on an outpatient basis. Psychology, that's myself, and I have a couple of trainees. So we provide individual therapy as needed. We do some psychological testing. It's sort of a case-by-case basis. We will create behavior plans if we have patients who are routinely demonstrating unsafe behaviors to try to help curb those on the inpatient side of things. I am also available to consult with teams, parents, therapists. Just gotta let me know. And I also, at times, will help to schedule or facilitate meetings between parents and kids prior to discharge. And again, that's sort of one of those things that occurs on a case-by-case basis. And then we have our OT and MTs. So they do their individual assessments and then also run a variety of groups. So that's discussion and activities and social skills and music and art and creative expression and all kinds of good stuff like that. This is a sort of overview of our daily schedule. It sort of changes from day to day a bit in terms of just, COVID issues, who's around. But we have a schedule of listed groups and of sort of what is meant to happen on a normal day. Our kids, and I actually need to change this. We send the kids to bed early, and this is just something to be aware of, that they go to bed about 8:30, and that's because we are very focused on helping our youth maintain healthy sleep, because the vast majority of young people are not getting enough sleep. So that can be a big sticking point for some kids when we're like, go to bed at 8:30, and they're like, what? But that's because we really want them to sleep as well as they can while they're here. So now we're kind of getting into some of the stuff that has changed a bit with COVID, right? So because our length of stay is short and because we truly believe that youth are most of the time better served on an outpatient basis, we really want to keep you guys as well connected to your clients while they're with us as possible. So to that end, we want you to remain in contact with your clients. We encourage you to do so. However, right now with COVID, we're not able to permit any visitors on the unit at this time, whereas before we could. So the patients are allowed to make and receive phone calls throughout the day, and you can call the unit directly and just ask to speak to your kiddo, and that's not generally a problem. The nursing staff will generally ask who you are, but it's certainly something we encourage. If there is a hope to do a team meeting while the patient is inpatient with us, we need those meetings to be focused on immediate safety planning needs and really involve only the minimum necessary team members. We do have some availability right now to facilitate like teams meetings like this with the youth. But because of HIPAA, we have to be the ones to send the invitation so that we can maintain HIPAA compliance requirements. And we also need to be very careful and choosy and limited in the scope of who is involved in those conversations. So if that's something that we identify being a need, it's really important that you all reach out and speak with the social worker or with myself to sort of schedule that and discuss the purpose and how we're going to make the most of that time, because we really do have limited time to sort of facilitate that. We've been doing what we're calling virtual office hours. So myself and our main social worker, Cynthia Esparza, have set aside chunks of time during the week when we are able to facilitate like a virtual meeting on Teams or something like that. These are unfortunately right now the only times we can facilitate these kinds of meetings because we have all this other stuff going on as far as COVID and groups and unit activities and things like that. Similarly, if we were to have a day where we would have 3 kiddos, all of whom needed a meeting the same day, I mean, there's a possibility we may not be able to accommodate everybody. And it will just really sort of depend on the needs of the patient and the teams and sort of where we're at with those things. So if you have a patient with us and you are foreseeing that is something that may need to happen, I would suggest strongly that you begin that coordination process as soon as possible so that we can kind of plan for it and make sure that everything is aligned for it to happen as well as it can. And then discharge planning. So I've alluded to this, but because we are acute stabilization, we are really, I mean, as much as we all love our jobs, we really prefer it if things can be managed for youth outside in the community, because that's where the best treatment occurs. So we really want to support that mission of wraparound to try to avoid this need for high-level care unless it's absolutely necessary. So to that end, we're not able to hang on to kids because of placement or because of respite. And we can't keep kids in the hospital for only those reasons or while they wait for a placement to materialize. So things like residential placement are looking for foster homes. And that has to do with the legal ramifications, the insurance ramifications, all of those things that sort of play into this side of things. We try very hard to do what we can to advocate and facilitate for a discharge plan. And as I said, Cynthia, myself, our other float social worker, we are happy to try to support you all with safety planning, with offering behavior modification suggestions or recommendations if we have them. So that means that if you have a youth in our care and we're sort of can already foresee a placement issue, it's really important to communicate that with us as early as possible so that we can help on the front end to try to support and be helpful to manage that as well as we can. And then on the day of discharge, it's just really important to know sort of who will be picking up the youth and when. There's a lot of sort of pieces from a procedural standpoint that go into us getting a child discharged from us. And so if plans change or people are going to be late, we need to sort of know that part ASAP as well so that we can prep the patient and sort of plan as far as staffing. So here is some important contact information. Again, we have the nurses station, which is the general phone number. You'll get the nurses. The patients do have access to a phone on the unit and in the milieu, so they can make and receive phone calls on that phone number. Cynthia and my numbers are both listed here, and then the names of the inpatient psychiatrists who work on the unit. So there's Dr. Moisio, who's our medical director, Dr. McClymans, Dr. Kondapur, and Dr. Wynn. All four of them also work simultaneously outpatient with youth through the wraparound clinic. So they all of them sort of share their time between there and here. And I'm pretty sure that's it. Yes, indeed. Questions?
Well, I think you did a great job. Thank you
you
so much for helping us out. If there's anyone that has any questions, please jump in. Anyone?
Yeah, thanks, Abby.
Oh, thanks, Dr. There's Dr. Moisio.
I was listening.
Do you want to show your face, Dr. Mosio, so in case anyone hasn't met you yet, they know what you look like?
Right?
Hope you were
see
ready
each
for
other again
that.
at some point in person.
Right.
And Maria, I can email you the PowerPoint if you want to be able to distribute it, just because it's got those phone numbers on it. You
Okay.
probably have the old version, but I can send you the sort of COVID update if you'd like.
Do you want to send it to Julie Miles?
Yes, I certainly can.
All right. I'm going to give you guys 2 minutes to get up, move around, get your coffee. Thank you, Abby. Thank you, Dr. Mosio. And we have our next presenter starting. Actually, we have him scheduled for 9:15, but he's already here. Anthony, are you ready for us in about 3 minutes?
Yep, I'll be ready whenever you are.
All right. So let's give people 3 minutes. We'll come back at 9:10. Go get your coffee, get your donuts, whatever you need. Take care of yourself, and we will see you in 3 minutes. All right. Anthony, we're going to go ahead and get started. You have until 9:55. So please, if you have a PowerPoint to pop up, if you'd like to go ahead and put that up, they're all yours.
Yeah, welcome everyone. I do not actually have a PowerPoint today because I'm just going to go ahead and talk about sort of who Diverse and Resilient is, what sort of services we have available, and then the best ways for you all to be able to connect your participants with our services. So my name is Anthony Harris. My pronouns are he, him, his. I've been working at Diverse and Resilient for 10 years now. We're an LGBTQ public health organization. Our focus is on trying to address the health disparities that LGBTQ people face in Milwaukee as well as Wisconsin. We do have a statewide focus in our work. And we do that through a variety of areas. And so I'm going to go through some of those today, specifically the ones where we have some direct service resources for people. So the first one I'm going to talk about is our testing program. So we have a pretty comprehensive STI and HIV testing program where anyone can come in and get tested for STIs or HIV. It doesn't cost any money, and when we have folks connected to our STI part of it and not just the HIV part of it, we also have resources available to help people if they need to get care for an STI that they might have, to get them connected to that care and to be able to get that care. So that's a really important part of our program. We partner with a couple different organizations in town in order to do this. One of them is Holton Street Clinics, which is just right down the street from us. They help provide actual licensed nurses to come in and do some of the testing that some of our HIV testers cannot do. So they're in the office. And so right now the times have changed from what they normally were. Right now the times are Monday through Wednesday, and it is by appointment only. And so at this point, if you have a person that you're working with and they're looking to get an STI or HIV test, they're welcome to come to Diverse and Resilient to get that done, but they do need to call ahead of time in order to get an appointment. I'm going to go ahead and just put the number right here in the chat box. And so that is the number to the office. And then you're just going to be asking for either Lorenzo or Willie. And those are the two individuals who are testing folks, and they're the ones who are setting the appointments. Right now we have slots for 4 appointments per day on Monday through Wednesday. And so they do get filled up pretty quickly, but we've been able to get people in and keep it running pretty smoothly for a while now. And so that's kind of where we're acting right now. I think that once if we get to a place where COVID has changed and we don't have to take so many different precautions, we definitely usually have a lot more testing times available and a lot more open availability for people to come in for testing. But because of the COVID situation, these are some of the precautions that we've taken in order to still be able to provide the resource, but do what we can to help create a safe space for everyone. So this is our testing thing. Again, this is not just HIV. This is also other STIs. It's really important that that people get tested on a regular basis if they're being sexually active. The CDC recommends that it should be at least once a year to get tested. I know that there are different sort of there are different behaviors that some people take that might want them to get tested more often than once a year. And so at that point, then a lot of times there's a suggestion of every 6 months getting tested. So it's something that we want to encourage you all to know about as a resource in case any of your participants are needing that. We don't need If they're over the age of 14, we don't need their parents' permission to get an STI test. They can just come in and get one on their own. And we do our best to try to ensure their anonymity if that's what they want. So if they get tested, they're the person who's getting told the results, not their parents. And of course, if they need care, depending on sort of like what kind of care they need, and what we have some that is free. And so at that point, then insurance isn't gonna like tattle on them. And if there's stuff that that can't be given for free, there are some programs that we can connect folks to try to still help them keep some of that anonymity. So the question is, what if they're under 18? Yes, between the ages of 14 and if you're 14 and up, you have the right in the state of Wisconsin to seek out your own sexual health stuff without your parents' permission. And so they can come in and they can get tested. And like I said, we'll give them their test results to them, and and they can make the decision on how they want to proceed. And that's what I was talking about. Oftentimes, it can be troubling if there's a cost associated with the testing, because then it's like, yeah, you can come in and do this, but then it's going to show up on your parents' insurance, and sometimes that can create awkward conversations at home if a child was not prepared to have that conversation with their parent about being sexually active. Our role at Diverse and Resilient isn't necessarily to encourage young people to be sexually active and keeping it from their parents, but we also want young people to protect themselves and to, if they do get an STI, get it treated, so then that way it doesn't have to negatively affect them in the long run. And so, so that's the reason why we do that. But yeah, if you're under 18, you can still come and get the testing services. If you're under the age of 14, that unfortunately you're gonna need to have a parent with them. I'd have to ask our testing folks. I don't think we've ever had anyone under the age of 14. I mean, honestly, most people come and get tested are 17, maybe at the youngest, and up. But I mean, it is a service that is available and a resource that is out there for people if they need it. So that is our testing program. And again, the point of that is try to reduce the amount of viruses and diseases within our community by making sure people know their status. And if they know their status, getting on to care. What we know is that most STDs can be cured, and the ones that can't can be treated, and oftentimes treated to a place where they don't have to negatively affect the person who has the infection or disease. So then that way we can again lower the amount of disease within the community, which then lowers the risks and the chances that people will continue getting infected. And so that's part of the reason why we do all of the testing, and why we work to try to create as many resources as we could for people who might have something to get the care they need without necessarily having to pay for it, if we can do that. I think it's a really good resource for folks to know about. Again, I think there's still a lot of hard times for people to admit if they have an STI, or to want to do something about it, or want to know for sure if they have one because of the stigma associated with STIs. And so we do our best to try to keep things really quick, really confidential, in and out. Our organization does a lot more than just STI testing. So if someone sees you coming into the DNR offices, it doesn't mean that you're coming in to get tested. And so, so there's a lot of sort of things that can be beneficial in that context. And also, even though we're an LGBTQ organization, people do not have to be LGBTQ, identify as LGBTQ in order to get tested. So that's an important aspect to put out there, that you do not have to identify as LGBTQ in order to get tested from us. We'll test anyone. And so with that, I'm going to lead into the next part of our program, which is a prevention program we have, which is our For and For All condom distribution campaign. And so for the city of Milwaukee, we've been asked to provide this campaign to the city. And so what we do is we do our best to try to make condoms as freely as available as we can. And so one of the ways that we do that is we create condom packs, and then we put them out throughout the community into different community-based organizations, a lot of public health organizations, a lot of clinics, in order to make condoms free and freely available for people to take and use. And with that, people can still come to our office and request condoms and get condoms from our office. It's not going to be, it's not just as quick as it used to be where you can just, walk in, grab some condoms, walk out, because we got to control who's coming into the office and how, and making sure people are safe. And so they're, have to ring a doorbell and, come in and, and if they say, I would just like to get some condoms, we'll just give them whatever condoms that they need. But on the 41 for All website, and that is, I believe it is 41forall.org. Nope. If you go to our website, on Diversity and Resilience website, we have a section on there for 41 for All. And if you go to that website, we do have a little tracking map on there where before, thank you. Thank you, April. Before COVID happened, we actually had a listing of the places where our condoms were available. I would say that you can utilize that as a place to see if there's condoms there. I would probably call the place ahead of time, because not all of the places are currently taking condoms. And so a number of them, we still have a number of our places that were taking condoms before COVID happened that are still taking condoms and making them available. But there are some places that just, they're not really wanting to invite people to just walk into their space right now. And so it doesn't make sense for them to be taking the condoms. And so I would just call ahead of time. But there's a list of locations throughout the city of Milwaukee that we've supplied condoms to. And a number of them are still getting condoms supplied to them. And so that is, so that's in the context, again, of sexual health. Again, if we could encourage people to be using barriers every time they're engaging in sexual activity, we can lower those rates of infectious diseases within our community. And so, again, that's another resource that any of your young folks, again, the same thing goes if they're over the age of 14, no questions asked. They can come in, get condoms, and it's good to go. We don't need a parent's permission. They can have access to those things. And so that's our 41 for All program. Next, I want to go into a few, before I move into those, the next program I would like to talk about is our Room to Be Safe program. And so this is our anti-violence program. I'm going to put the website up here into the chat box. So our Room to Be Safe program is an anti-violence program. So if there are any LGBTQ people that are experiencing violence, whether it's in a relationship, if it's at home, if it's in the community, with just a hookup, any of those things, if they're experiencing violence and they want to talk to an advocate and they want to talk to someone about getting resources, about figuring out what their next steps are, how do they move forward, what can they do, we have our Room to Be Safe program is designed specifically for that. And we have an advocate in Milwaukee. Her name is Jennifer Williams, who is happy to talk with anyone who is experiencing violence, and can do safety planning, can talk about sort of like what sort of options does the person have, and then with that, we've also been working really, really hard to work with different domestic violence shelters, not only in the city of Milwaukee but throughout the is all the programs for non-LGBT people as well, or just the testing program? So the testing program and the condom program are for anyone. I know our Room to Be Safe program is specifically for LGBTQ folks, but I think if someone was experiencing violence and they contacted our Room to Be Safe person, they would work with them and help connect them to resources. I think that one of the reasons why we talk about it in the way we do is that a lot of LGBTQ folks don't feel as comfortable or don't feel like they are getting the support that they need when they're going to a lot more mainstream domestic violence resources, specifically if the person identifies as a cisgendered male or as a transgender person. Oftentimes, the resources that are available aren't quite as comprehensive, and oftentimes can be hard for them to access. And so that's why we have our Room to Be Safe program. But that's a great question. Most of our programs do focus on supporting the LGBTQ community, but the testing program and the condom barrier program are definitely for anyone and everyone. We want to make sure that we're, doing what we can to overall lower that viral load within the city. And the best way to do that is to, make all the resources available to everyone. But Room to Be Safe, again, they can contact an advocate. We also have advocates up in the Appleton area. And then just like I said, we're working with folks statewide to try to really increase the ability of these other mainstream services to better serve LGBT people who are facing violence in their communities. And this doesn't have to be just about dating violence either. It could be, if they've, if in public someone's being violent towards them, this is a resource that they can access. And so our Room to Be Safe program is a really great program for people who might be experiencing that, because we have someone who is LGBTQ, who can be an advocate, talk with them, help them figure out what they need, and then have the person not have to worry about their LGBTQ status get in the way of getting the help that they need, which is oftentimes what people can face, or what will happen sometimes when LGBT people are trying to seek out that help, whether that's through the police department or other services. It can be harder for LGBT folks to access those services. So that's our Room to Be Safe program. The next program I want to talk a little bit about is our Community Health Promoter Program. And so this is a program specifically for young people. And this program, again, is we're focused on LGBTQ young people. If there is a young person who doesn't identify as LGBTQ, but is a big ally to the community and wants to be supportive, we can find space for them and work with them. And so this is just sort of a small little youth group where young people get together. They learn about the different health disparities that the LGBTQ community is facing, and they learn about ways in which that they can talk to their peers about those topics. And then just also have some space with each other. Now, obviously with COVID, that's kind of thrown a big old monkey wrench into everything. And so we're not meeting in person. It's just not safe right now. And speaking with the young people that are part of the program, they would rather not. I think they want to meet in person, but they're also concerned about sort of like how they can do it safely. And so what we're doing is we're meeting in virtual chats. Because of all the extra Zoom meetings, again, this is sort of like from the young folks, we've backed down the amount of times that we've done it. And so now we're about doing it maybe once a month is what it's looking like at this point. And so, but if people are interested in following that, they can follow our Facebook page, which is Rainbow Alliance for Youth in Wisconsin. And then also they can follow our Instagram page, which also talks about, which is Ray, Wisconsin, which also talks about when we're meeting and what's going on. And so that's the way that we've been doing that. I think that we're looking at always trying to think of how we can do a better job of supporting our young people. Obviously, the other aspect of that is the people who are connected to us that we have contact information with. We've been following up with on a pretty regular basis, doing one-on-ones with folks, just checking in, seeing how they're doing, making sure that that they have what they need. And if they don't, then our next role is then to try to connect them to the resources that we can. And so that is our sort of youth programming aspect. And in the past, when I've done these sort of presentations for you all, I've always been able to talk about, just send your young people, just send them on in. You don't need to contact us ahead of time. Well, unfortunately, with this, if you want us to get connected to one of your young people before one of the public meetings, we can do that. But you just need to reach out to you can reach out to me, and I'll put my email address in the chat here. You can reach out to me, and then we can set up a time to do a virtual chat, and we can meet with the young person and figure out sort of what needs that they have, as opposed to just stopping on in and saying hi, because right now, I'm not sure when I'm going to be in the office. I'm not in the office all the time. Today I'm doing everything virtually. A lot of things are done virtually right now, just for safety reasons. So let me finish putting in my email address here. So feel free, if there's a young person that is just maybe needing a little bit of support, wanting to feel connected to other LGBTQ young people, this could be a great way to do that. And so that's our community health promoter program. I believe that most of the young people that you all work with are under the age of 18. But we do have a few other programs I want to just talk to you about, and this could be for any of your young people that are in the process of aging out, and you're wanting to find a place for them to be connected. So we have two other programs I want to speak about. The first one is called SHIBA, which stands for Sisters Helping Each Other Battle Adversity. So SHIBA is kind of a social support group, leadership development group for African American trans women. Oh, we serve up to 23-year-old. Oh, awesome. It's just both these groups are 18 and up that I'm going to talk about. And so SHIBA, it's for African American trans women, and so it's definitely a space for trans women to get together, talk about sort of what's going on in their lives, as well as get access to resources. And so we've been really lucky within the last couple of years of getting some additional funding for this program. And so we have a counselor that comes, a licensed counselor that comes and actually can be available for any of the SHIBA participants. We also have had people come in and talk about different sort of job opportunities and trying to work on some workforce development stuff to try to really provide some additional resources for these women, as well as giving them a space to have community. And so that is still meeting. Again, they're kind of meeting virtually as well, because it's just not safe to meet in person in large groups. And so, if anyone is interested in that, I'm going to put down, so Yante Turner is the person who runs that group. So he would be the one that you would want to contact. If you have a person who might be interested in joining SHIBA, Yante would be the person to connect with, and then Yante can get them connected into the group. The other one is a lot more broad, and so this is the IM. It stands for Intersectionality Among Men, and this is specifically a group for Black and brown, same gender loving men, 18, I think, all the way up to 29. And so this group is specifically has a focus on HIV prevention, but overall it's much more about community building, having space together, leading to address different issues within the community, and then just being connected. And it's a really great time for these young men to be able to have space together. That's really about supporting one another and looking to support the community. And so again, that's just sort of another sort of social support group with a prevention base to it, around specifically HIV prevention. And there's also talk within that about prevention around with HIV prevention and the connection of substance use to HIV transmission, and so some prevention messages and activities within that as well. Again, they're also meeting virtually on Zoom chats and whatnot. And then I will put so Stacy Clark is the person you're going to want to contact if you have someone who would be interested in joining that group. There's Stacy's contact information, and they would love to have more guys join who are interested in joining and being part of the group. So that's definitely another group that folks could join. Again, both with Sheba, the person definitely is going to have to identify as someone who's transgender, and specifically a trans woman. And then with IM, they would have to identify as same gender loving, and identify as male or trans female. Those are with those two groups, those are the communities in which the funding is focused on supporting, and so that's who can join those groups. So those are the things that are still actively running at Diverse and Resilient, that have some more of those direct service roles. I know that Yante also has been, I almost forgot, Yante is also working on a trans youth leadership council here in Milwaukee, and so and I think that is 14 to 24 is his age range he's working with on that. And so if you have any trans young people, so this could be any trans young person, any gender non-conforming, any non-binary, who are looking for support, looking to be connected to other young people who identify the same as them. And Yante Turner, the email I gave above Stacy's there, would be the person to contact for that, because he is also still trying to meet with those young folks, and ensure that they have access to resources as well. So those are sort of like the rundown of the services I have. Normally at this point, I'm usually given some tour. I have a nice little like pamphlet, a folder of like all sorts of additional resources I usually give y'all, but I just don't have those digitally to give. And so I don't know if there's something I can maybe send to the office, and I don't know if they can get it to you.
Yeah, so if you want to send materials to Julie Miles, and
Okay.
she can send it out to all of our care coordinators, actually. So the group that
fabulous.
you're talking to is a group of staff that are generally new to the work that we do as wraparound. They could have worked in other, professions or in the community, but they're just getting acclimated to how we do business, so to say. But Julie can send it out to, we have like 150 staff at least that we can send that out to. And I think it's a good reminder to say, hey, the community is open. We're still doing business, but it just looks a little bit different right now. So yes, you guys, Diverse and Resilient has been a great partner with Wraparound Milwaukee, and we've done a lot of work with you guys. So definitely happy that you guys could join us today. But if any of the folks on the line want to ask questions or need clarifying information, please jump in. We got a couple minutes yet. I know you're there. I'll call on you.
Well, I mean, and I just want to say again that at Diverse and Resilient, our focus is on trying to do what we can to create not only resources for LGBT people, but working towards creating a community that is open and accepting and can work with LGBT people in a way that's supportive of them. And so, you talked about working with Wraparound. I mean, we've done lots of trainings with Wraparound in the past. And so, there are a lot of other resources that we could have available to if you have an organization or other staff and other places that you're working with that you're wanting to have some competency trainings and stuff to have done. Those are some things also that we do. I just didn't bring that necessarily up in the forefront of this conversation, figuring that you're looking at what resources can my kiddos have access to if they need access to them. And LGBTQ training, I mean, maybe that might be helpful, but I'm guessing that's not what you're looking for the kiddos. So there are a lot of things that we can still also do as an organization that can work towards creating a much more holistic and helpful community that is supportive of all peoples. And I just wanted to give a shout out to April. Hi, April. I didn't know that you're on this thing. Thank you for putting up the form website. April worked with us at Diverse and Resilient. So.
Okay.
Great. So yeah, I mean, I guess I ended a little early. Sorry if I ended
Oh,
too
that's
early.
okay.
But yeah, if anyone else has any other questions, my email is in the chat. Please feel free to reach out and email me directly. Even if it's sort of like you have questions about what is there ways that I can say things better? Is there ways that I can talk to young people better? And how you can work on your own sort of ability to be a supportive ally to LGBTQ young people. And because a lot of times people have these questions and they're too afraid to ask them in a group because they're like, I don't want to sound ignorant. I don't want to sound mean. I don't want to come off as being offensive. And just know that if you're coming at me wanting to learn how to not be offensive, you want to ask me some questions, I'm not going to be offended. So feel free to drop me an email and we can work something out and I can figure out the best way to support you also the way you can support the young people.
Great. Well, we definitely appreciate your time with us this morning. Definitely keep in touch.
Will do. Thanks, everyone. Have a
All
great
right.
meeting.
You too. Thank you. All right. We will give you guys 5 minutes. Let's see. Who do we have up next? Monique, do you want to start early or do you want to start at your time?
I can start at my time. That's fine.
Okay. So that means you guys will actually have a 19-minute break. So we will come back at 10 o'clock and resume our training. Does anyone have any questions in the meantime? This is a quiet bunch. Julie, are you there? All right, we'll come back at 10. Hi, Monique.
Oh, my
If
mic.
you want to put up a PowerPoint, you can go ahead and share your screen if you want. It's totally up to you. Hey everyone, we have Monique from Energy Assistance, which is part of Milwaukee County. So I'm going to let Monique go ahead and introduce herself and then let us know what Energy Assistance has been up to.
Okay. Good morning, everybody. My name is Monique Fain, and I'm the Quality Assurance Specialist for Energy Assistance. I work for Milwaukee County Department of Health and Human Services. And what I'm going to do is I'm just going to give you an overview of what Energy Assistance is and how you can refer your customers or help them to apply for Energy Assistance. Did I share my screen? I thought I did. I put it down here.
It was there.
Okay, it's still there. Okay, so Milwaukee County Energy Assistance is actually, well, not Milwaukee County Energy Assistance, but Energy Assistance is a one-time annual payment towards your energy bill. It's heating and electric. Our heating season, well, actually our actual overall energy season started October 1st of, and it'll end September 30th of 2021. Now our the heating season is where customers can apply for energy assistance. It started October 1st and it'll run to May 15th of 2021. A lot of people have a misconception of what energy assistance is as far as income wise. They think it's a low income program, but it's actually a program for all families. There's the criteria that you have to meet to qualify for the actual program. One is to live in Milwaukee County, be at or below the income level depending on your household size, and also have an energy bill in your name. So this is actually the flyer that comes up if you go on Milwaukee County website and Google Energy Assistance. And I'm just going to go over this with you quick. So our hours of operation is Monday through Friday. We have extended hours for the month of October just because it's the beginning of the heating season and we encourage a lot of people to apply at this time. It's the best time to apply actually. So Monday through Friday we work, on Saturdays we do 8 to 12. We're usually, our hours are to 7 p.m. except on Wednesdays. Wednesday and Friday we work to 5 p.m. Right now we're not doing any face-to-face applications because we usually have 6 different locations. So since we're not doing any face-to-face applications, we're doing everything on the phone or online. This actual flyer helps you to schedule appointments. It also lets you apply online. So if you click here, you'll be able to apply online for energy assistance, or you can call the 270-4MKE phone number and schedule an appointment with a live person, or you can call 211, which is 24/7, and get an appointment scheduled as well. Again, qualifications, you have to meet the qualifications to apply for energy assistance. And again, it's just being a resident of Milwaukee County, meeting the income levels, and having an energy bill in your name. So to go on to talk about the income limits, we used to count 3 months for the test period, but due to COVID, it's went to 1 month now. So instead of us requesting, if you have an appointment and you apply for energy in the month of October, previous to COVID, we would need 3 months of income. And that would be, what would it be? July, August, and September, because we're in the month of October and you're actually applying for benefits in October. So with a 1 month test period, since it's the month of October, you only have to provide the month of September's income, and that will qualify you for the energy assistance program. Okay, so due to family sizes, this is what I usually tell customers. If you want to know if you qualify for the program, what you would do is you would go onto the website and you can look to see, your family size or your household size, and then you'll go over and you'll look to see for the 1 month. See if you're at or below the income level. If you're at and below the income level, then there's a possibility that you may qualify for the program. Also, you have to be a Milwaukee County resident and you have to have a utility bill in your name. Okay, so if you meet this, then 9 times out of 10, you do qualify for the program. And so what you would do is you would either click here to make an appointment, or you would call this number to schedule an appointment with the individual, or call 211 to get an appointment scheduled. Some things that you would need to have with you during your appointment. You would need to have everyone in the household birth date, their social security number, all of the household income. So if you have a child if you have a partner that's working or another adult in the household that's working, you would also need their income. And their income, the entire household income has to fall at this level or below to qualify for the program. So those are the things that you would need. Also, your utility bill, so your We Energies bill or whoever your utilities is handled through, you would also need that account number for the program. Let's see what else. So we usually have 6 different locations, but due to COVID, the locations are closed. So we have a location on Fond du Lac, we have a location of Brown Deer, we have James Lovell location, which is downtown. We have a West Dallas location and 27th Street location. There's 2 locations that they're allowing individuals or customers to drop information off. So if you need to drop off like your check stubs, if you don't have access to email or you don't have access to text messages, you can drop the information off on Fond du Lac or on Chase Avenue. So those are the 2 locations they're allowing people to drop information off at. Due to COVID, a lot of things we're doing like over the phone, we're doing over email, we're emailing check stubs, we're emailing certification pages, we're sending out mail for notification letters and things like that. So that's how we're keeping up with documents and being able to keep up with the program. Due to COVID, because due to COVID, a lot of things have changed and we're not having any face-to-face contact at all. Some of the other programs that we offer through the Energy Assistance Program or our partnering programs are like weatherization, furnace, and fuel. But I'll go through that. I'll show you a different flyer for that. We also have like emergency crisis. That's for no heat. So if you qualify for energy assistance, you'll qualify for emergency crisis. And that's for people who don't have any heat in the household. You call the 270 number and we'll get you referred over to the crisis program for emergencies. And then this right here is just our survey. So you gotta let us know how we're doing within the program and if some things should be changed and things like that. So if you clicked on here, it'll take you to a survey to actually complete. And then we also have a crisis prevention. So crisis prevention program is to actually help customers prevent disconnection. So it runs from October 1st to the end of the actual season, which is September 30th. So even though our heating season is October 1st to May 15th, the entire season runs from October 1st to September 30th of the following year. So crisis prevention, it's a few different initiatives within the crisis prevention, but they give $300 towards bills just to prevent disconnection. Let me see. Is there any questions so far? And I did put my email and my phone number in the chat box. If you guys have additional questions or you have a customer and they have questions, you can call me. And also I did put the phone number, the 2704 MK phone number, and the Keep Warm MK or email in there as well. I have another flyer that I wanted to go over with you guys. So these are the additional services that Energy Assistance offers. We have a furnace repair and replacement program, and these are through our partners. So that's Partners, SDC, and La Casa. They do our furnace and our weatherization program. So in order to qualify for the furnace and replacement program, you have the owner of the home as well as the tenant of the home has to qualify for energy assistance, or they have to have an energy assistance application completed and submitted for benefits. So with this particular program, if your furnace goes out, they'll actually replace it or repair it if you fall under the qualifications and you apply for energy assistance and was approved. Weatherization program, you also have to be approved for energy assistance, and it kind of helps you if you have excessive energy burden. So they kind of do installation, they do walls, they do floors, they try to help reduce the leakage of air to keep your heat inside of the house, things like that. So that's what the weatherization program is. And again, you have to qualify for energy assistance in order to qualify for the weatherization program. Our crisis services, we have, again, the emergency crisis, and then we have the regular crisis, prevention crisis. So emergency crisis, again, is for people that have no heat in the home at all. So if you have no heat, or you know that your heat is about to go out or something like that, you may qualify for the emergency crisis, and you can get up to $750 towards that, towards like replacing the furnace, or getting heat or propane or oil or something like that, whatever it is that's forcing you to have that emergency crisis for no heat. But again, emergency crisis is actually like no heat within the next 24 hours or right that moment. Prevention crisis, again, that's just preventing you from a disconnection of. So if you have if you have a bill, or you're facing some type of disconnection, you can always apply for crisis assistance. And crisis assistance, again, goes for the entire season, so October 1st to September 30th of the following year. Also, we have crisis services for oil and propane.
Monique, before you move forward, let me go back to crisis.
Okay.
So that crisis is not the one you're on here, emergency crisis. Go back down. It's not in regards to the furnace. So the emergency crisis here is for customers, like you said, that are with no heat or will have no heat or energy within the next 24 hours. It is an additional payment we do to the utility company to help those customers in those emergency crisis situations stabilize. The pre-approved range is between $300 to $750, but in Milwaukee County, we generally cap it at $600, because that's what We Energies requires to restore or prevent disconnection. This is different from the furnace. When we get to the additional services, furnace services could be, $2,000 to $10,000 or whatever it is, those amounts. That's a different type of crisis, but it's all free to the customer. It is funded through the Home Energy Plus program from the state of Wisconsin. So I just wanted to clear that up a little bit. But those are all of these additional services: furnace repair and replacement, weatherization program, emergency crisis, as well as prevention crisis. Those are added benefits customers get once they become eligible for the regular benefit that Monique just spoke about. And I'm sorry I jumped in. You all, I'm Cleopatra, the program manager for energy assistance. Monique is just moving into presenting on this. So she just made her year with us, so we're pushing her out there. But I just wanted to make sure that part was clear. Sorry, Monique, you can go ahead.
Thank you for helping in the clarification.
No.
So yeah, everybody, this is my first time presenting at a wraparound or a community resource event. So I really appreciate Cleopatra jumping in and clarifying some things for me. So to go back, so this is the flyer. I can send this to you guys, or you can actually go online and it's there. It's actually, when you go to the keepwarmmke.org website, it's actually on here, additional flyers. So you would click on here if you needed to maybe print some out to give to your families or your clients. And Cleopatra, is there something else that you think I should be reviewing or covering?
So I think you covered the majority of it. It's just important for people to know that it is an income-based program. And like you showed the guidelines, even though historically people have this idea that you have to be poor to qualify for this program, you guys can see from our guidelines, you can still make $4,700 with a family of 4 for the month and still qualify. So people could be making a really good wage and still qualify for this program. So we're trying to dispel some of those myths in the community because even when I've gone out to the schools last year, we did a lot of schools, and a lot of the teachers thought they wouldn't qualify, but then when they looked at the income guidelines, they're like, oh, I qualify for this. So just giving the information to people, your friends, families, clients, and also, encouraging them, look to see if your income falls into those guidelines before you make that decision. Because it really is, it increases a little bit every year. So, and because we've moved to the 1 month, that makes it a lot easier for a lot more people to qualify as well. This program is for renters as well as homeowners. All the services that you see provided are for renters and homeowners. Some people, there's a misconception that it's only for either or both. Additionally, people do not have to have a past due bill in order to qualify for this benefit. Um, and I actually had people call this season because we did automatic applications for some individuals that qualified last season. We knew they would qualify this season and didn't want to have them have to come in again. And one of the ladies called and said, oh, I got this automatic payment. I don't know if somebody else can use this. I paid my bill month. It is totally an income eligible program. So even if people are paying their bill or don't have a past due balance, if they qualify for this by the income guides and household size, they'll get a credit. So we have some people that make it so that on average they get about $400 for the regular benefit. Then in addition with the crisis funds, they may get an additional $300 to $600. Some families, larger families, even with the regular benefits, can get, upwards of $600, $900, depending on the algorithm is in the state system. So we don't determine the exact amount they get. But once we plug in all their information, income, household size, then the state gives us the result. But like I said, if they have a zero balance and their benefit amount says 600, they have $600 in credit on their energy bill. Can you imagine what families in today's world could do with $600? The kids are running the bills up anyway with the online schooling and everything. So just really encouraging people to apply. There is enough money to go around. We serve about 60,000 customers a year, but when we do a scan of Milwaukee County, we see that there's over 100,000 people that fall in our income guidelines. So we still feel like we're not catching everybody that could benefit for this program. And you all know with any federal funds, if the county doesn't use it, they lose it. So the more we want, the more people come into our office or contacting us to get assessed for the services so we can make sure they get them, because we want to keep this money coming to Milwaukee County. So if they qualify, really encourage them just to, schedule an appointment, get an application done. You all can schedule an appointment for them as well. It's easy to just click and go to the website. All they have to enter is their first name, last name, phone number, and then their zip code, and then it'll show them all the available appointments. And then you can just fill in the information. You can do it for them or while you're with them, and then their appointment is scheduled. At the time of their appointment during COVID, of course, like Monique said, we're calling them for the appointment. And the appointments usually takes 15 to 30 minutes tops, depending on how big the family is. Of course, if it's a family of 6, gathering all that information, it'll be closer to the 30-minute timeline. But still, even for some of those customers, repeat customers, their time frame sometimes lessens to about 15 because we have gathered a lot of that information and it's just doing updates to their new application. So it isn't like it used to be years ago where people had to stand in a long line, they'd be there for an hour, a few hours. It really is, if they schedule an appointment, they're in and out. In most instances, we are able to tell them their benefit amount if they're able to provide all the verifications during that interview. But if not, then we try to work with the customer to see what's the best way to get the documents from them that's needed the quickest in order to get them processed. And then the benefit is applied right to their energy bill. I do want to say some customers with heat included are hesitant to apply. We provide benefits for people with the energy burden. So if they have electric, they pay electric, they pay oil or propane. It is not just if they have a gas bill. So even if their heat is included, a lot of times people with heat included are paying something extra on their rent. So that helps us see if they qualify for benefits as well. So, but when in doubt, I say just have them schedule an appointment or contact me or Monique to ask the question to see if, if this person should actually schedule an appointment or apply. But they can call, 270 for MK is our call center, during regular business hours. Regular business hours are 8 to 5, Monday through Friday. What Monique just showed you all are the hours we are in extended through October because our season just started October 1st. We extend those hours, but if they call, they can ask questions. They don't necessarily have to schedule an appointment at that time, but we highly encourage people to schedule if they think they may qualify and just go through the process because there may be something that we can more information we can give them to help them be able to qualify. Some people may apply 1 month and maybe they got an extra check. You guys know those months where you get an extra check that much month and that may put them over. We may say, okay, let's not process yours or let's let this deny out. Come back next month so we can process you with your regular income. People can apply as many times as they want. They can only get the benefit once. So if they end up getting denied and their income change, like a lot of things happen for our families due to COVID, people were making a lot of money and then COVID hit and a lot of people were laid off or had reduced hours because we look at the one most recent month. If their income changed, they could qualify because of that month. So just want to add those things. And then Monique, if you had other information to provide.
Just if you have questions, like Cleopatra said, you can always reach out to me or her. And on the actual flyer, it says if things don't go right or go plan, you can always call this number, which is my number. There's the email address there as well. I want to talk about the weatherization day. So we have 2 events that's coming up. We have a virtual event, resource event that's coming up October 30th from 1:30 to 6:30. To access, you will go on to keepwarmmke.org. Cleopatra, you want to talk a little bit about the virtual?
So Weatherization Day is our annual way to kind of showcase and get more information out to the community about what our weatherization partners do. If you scroll back down to the weatherization agencies, Monique talked about, weatherization is one of the services individuals can get if they qualify for regular benefits. So with the weatherization program, they really just do a real big audit of the home and see how they can make that home more energy efficient. It might be replacing light bulbs, replacing appliances, insulating the home, swapping out the thermostat, doing all different kind of things in the home to make it more energy efficient. So overall, it brings down their energy costs throughout the year. So in addition to getting a regular benefit payment from energy assistance, you'll get and possibly a crisis assistance payment if they need more help than the energy regular benefit. They get the weatherization, then it brings their bill down, saving them another few hundred a year. And like Monique talked about too, also the furnace repair and replacement. Those weatherization furnace repair and replacement are done by our weatherization partners. Our 3 partners in Milwaukee County are Partners for Community Development, the Social Development Commission, and La Casa de Esperanza. One thing I like to tell professionals that we present to is sometimes you may get customers that say, this agency called me. I think they're trying to scam me, telling me I can get all this work for free. We've gotten that a lot. You tell a customer, we can do $10,000 worth of work in your home, no cost to you. They're like, what? Who are you? And so what happens is when we do their energy application, Weatherization on the backside is seeing what households are having high usage, and they may do direct outreach to those customers because high usage indicates some energy inefficiencies in that home. But when customers get a call, especially some of our elderly customers or individuals in our community that are not familiar with energy assistance full circuit of services, they think it's a scam, so they won't return the call or things like that. So if you have customers talking to you about La Casa or SDC or Partners for Community Development, you can assure them that, yeah, they're connected with Milwaukee County Energy Assistance Program, and they're just trying to provide you additional support to bring your energy costs down. So every year we do an event to raise more awareness about what they do, and usually it's at two or three of our locations. But due to COVID, we've taken it all virtual. We will be sending out an email next week with the more information on these 2 days. So I'm just going to give you a brief overview. And also tell you that on this website that Monique is showing you, keepwarmmke.org, there'll be a banner at the top of it within the next couple of days, probably by Monday, where you can click on it, and that'll actually get you access to the weatherization event. So it's on we're doing it in two parts. On Friday the 30th, it's all virtual with some community organizations to provide resources, like a resource fair virtually. So people will be able to go in there and click on the different booths, get information about the services those entities provide. There's a couple videos on there. Our county exec is doing a video on there because annually he proclaims October 30th Weatherization Day, and really encourages people to, think about their energy usage, get the services from weatherization and energy assistance to keep their costs down. And then there's some educational videos in there as well about how to lower the costs in your home that are created by our weatherization partners. On day 2, is going to be a grab and go event at 2 of our locations. So for Milwaukee County Energy Assistance, we actually have 4 locations which are temporarily closed. But our 4 locations, we have one we have one on Fond du Lac, one at Chase Avenue, South 27th Street, and then one downtown on James Level Street. For the Weatherization Day, we're going to be hosting a grab and go event in the parking lots of our Chase Avenue and our Fond du Lac Avenue locations. So our Fond du Lac Avenue is 4906. West Fond du Lac Avenue. Monique, if you want to type these in the chat. Again, more information. If you come to this website next week, you'll be able to click and get all this information as well. But Fond du Lac is 4906 West Fond du Lac Avenue. Chase Avenue is our UMOS location at 2701 South Chase Avenue. From 9 a.m. to 1 p.m., the grab and go events on Saturday, the 31st, is the where they can come and get these prepackaged bags with resources about energy assistance, weatherization, help with mortgage, help with rent, the information from the ADRC, Housing Division gave us some information. You just brought us some information for those bags. So there will be some treats in there too, some candy because it's Halloween, some energy saving light bulbs while supplies last, as well as the weatherization kits. From 10 to 12 during that event, Jammin' 98.3 will be at both of our locations as well, playing music, getting people to come through the radio, but they're also raffling off an Amazon tablet at each one of our locations for participants. It is all socially distanced. We will have, they won't be able to go up to the radio station, but they'll be able to text from their phone to enter the contest and also be able to just walk up or drive up, grab their bag, and keep going, instead of having deep conversations. But so that 2-day event, the first day, the 30th, this is all virtual. The second day is the 31st, which is grab and go. I did forget to mention that even though the 30th is virtual, it'll go live probably Wednesday. So throughout the week, people can go in there and look and at the vendor booths and everything. But on the 30th at 2 o'clock, we'll actually have a Facebook Live panel of some of our energy assistants, managers, and our weatherization managers will be on there to do a Q&A with people in the community about energy assistance and weatherization services. And I'm long talking. If any of you know me, y'all know I long talk. But are there any questions for Monique Rye? All right. Well, thank you all for your time. Again, if you have any questions in the future, feel free to reach out to one of us. Thank you so much, Maria, for putting this together. The resources I've heard so far, I'm like, wow, I did not know they did that. So I'm going to stay on the line for a while just because I want to hear
Oh, please.
the other information. I think this is a great virtual community resource event, and we're happy to be a part of it.
Well, thank you for coming. I know this is just definitely a different way of doing this module. Previously, I would have care coordinators pair up with other care coordinators that they didn't know, and they would drive together and they would go out to the different resources. Sometimes they would have an address, sometimes they didn't. Most of the time they didn't have an appointment, and it's really for everyone to get a feel of how would a family feel if we just handed them a brochure. So, just, helping families navigate the different resources that are available. Definitely energy assistance is a big one that I would say for our care coordinators on the line, that if you're not familiar with energy assistance, you might as well learn a lot about it right now, because it is generally something that comes up with our families often. It is something that they do struggle with because energy bills can add up quite quickly. So definitely getting that information is huge. So
Right.
definitely.
Can I add a little bit to that, Maria? I'm sorry.
Sure.
Because of our no wrong door vision in DHHS, we have started to transition energy at all of our access points. We haven't moved to RAP yet, but we have ADRC and DRC, well, Aging and the Disability Resource Center staff have already started proactively asking their customers, no matter what they're seeing their customers for, if they already did their energy assistance application, and if they have not, they're scheduling them an appointment right then.
Yep.
So it, like you're saying, is really important for the coordinators to really be in the know, because we're branching within DHHS and we're moving out to our contractors as well and doing that education. Impact 211 is doing proactive scheduling for us as well, for people that call their line for any resources. So it's coming.
It's coming. And it's so exciting, because really a family should be able to have one person that can help them navigate so many things.
Right.
And with care coordinators, because of our caseload, so to say, our family size, we do operate anywhere from 8 to about 14. It's not like case management where you have about 150 families at one time that you're servicing. So you really are that point person for that family. So once they're working with us, they shouldn't have to go somewhere else to learn about different resources. We should be the person who knows most of the resources that we can point them to and get them connected with, so that they aren't out here, using space heaters, which can be dangerous, or using their stove, which is also dangerous. So, keeping your eyes open when you walk into a family's home and you're like, oh, it's a little cold. And then you notice like, oh, the burners are going, but there's no food on them. So things like that, to keep our mind, our eyes open, our ears open, because some families, they're going to try to make things work. And that's a strength of theirs, that they're trying to make do with what they have. But when the resources are out here, they don't have to do those dangerous things to try to keep warm. I mean, it's a basic human necessity, right? So definitely making sure that you are familiar with energy assistance, I would say is really important to do. Any questions so far? anything that you heard about today so far that you're like, hey, I need more information on that? Or, what else can we be doing with community resources?
So if a family calls for an appointment for energy assistance, how far do they give them appointment? Like if they call this month?
It depends. So we were, as of earlier this week, we were scheduled out until like November 9th, but we added some dates. Like, so we're blowing up in our call center right now. We got like 2,000 calls for a couple days this week already. So we're doing callbacks. So I'm jumping in and calling back. And I was in the system earlier this week, and we had appointments open November 9th. But then yesterday when I was scheduling, we had added some more. So there are some people that I scheduled yesterday that will have appointments on Monday. So it just depends on how fast the appointments take up. Sometimes in peak seasons, it could be a few weeks out. Sometimes it can be within the next couple of days. It just depends on the customer traffic and who's who's trying to apply at that time. Any other questions? Thank you for that.
All right. We have our next presenter at 10:45. So you guys have about 10 minutes to, take care of yourself, get up, move around. However, we will be having Sojourner Family Peace Center at 10:45. And then we also have community advocates today as well. And then we have Owens Place giving us the virtual tour this afternoon as well. So like I said, we are very busy. And we will keep it moving with our presenters because, this is valuable information for all of you. So definitely stay on. You're more than welcome to stay. Care coordinators, you do need to stay. So don't leave us. But yes, resume back at 10:45.
Good morning, Maria. Are we on a break until 10:45?
Yes. And you're right on time. I was just looking for you. I was like, where is she?
I'm here. I'm here. I'm like, oh, it's so quiet. What's happening? Is there something wrong with my sound?
They're getting their coffee. They're, getting up and doing their jumping jacks and getting all
Oh,
ready for you.
yeah, that's important stuff. Thank you.
Yeah. Well, and this is so different because usually when they do this module, they're up and moving around and, they're going from place to place. They're taking pictures. They're, saying like, different reports back. It's just really interactive. And this time it's like we're all in a separate space. So trying to make the best of it.
Yeah, I'm sorry. I haven't quite figured out how to be interactive virtually, especially with a short amount of time. But
Oh,
I do
no.
have all of the information, and I can send you the PowerPoint afterwards if you want to distribute it.
Okay, sounds good. And if you want to project it, that's up to you. If you just want to talk, that's fine too.
I think I want to project it because I think it helps people who I think it helps some people.
Okay.
Yeah.
All right.
Okay, what's that? That looks good.
It's French vanilla frappuccino, those Starbucks ones,
Mm.
Yeah.
So it looks like there are 23 people in the meeting, including myself. That's a good size.
Yeah.
I wish we were in my conference room, but it
You
is
gotta
what
make
it is.
do.
Yeah. Yeah, I was just updating a couple of slides and I'm like, oh, it's 10:40. I better get my buns over there.
Wasn't it nice? You don't have to leave, find a parking spot, find the meeting room, find the different thing.
Oh,
It's a little
goodness.
bit different.
Yeah.
There's pluses and minuses to it.
There are. Saving a lot on gas. Don't have to drive in the snow.
Yeah.
Yep.
Well, I don't know about myself, but I know I will be driving around in the snow. Because even during all of this, I've been out and about and still dropping off information, even to you guys.
Mhm.
One of the officers was doing a drop before our September event, I believe. They were
Mhm.
handing out some information, so we got some stuff down to you guys down there. But
Yeah.
still out in the community.
Yeah, I'm still in the office like once or twice a week, depending, if I need a signature or good internet connection or just to be out of my house.
Right. I feel that.
Yeah. Yeah, I went in yesterday because I was doing a panel for MATC and it was an even shorter period of time. And I'm like, ooh, if I have any technical difficulties, I'm going to be really in trouble.
Okay.
Yeah, because it's Domestic Violence Awareness Month, so there's a bunch of stuff happening.
Yeah.
Yeah, and had technical difficulties with Marquette University on Tuesday, so that's why I was so nervous. I think it was the way the meeting was set up, because yours was flawless.
Oh, you know what? I crossed my fingers yesterday.
I hear you.
Cleopatra, do you have a question or is your hand just raised from last time?
Oh, yeah, that was from last time.
Okay. Just wanted to
There
check.
you go.
Right.
I was like, Liz, you already have a question.
Excellent. That'll be way more interactive than what I have planned.
And Liz, actually, Cleopatra is from Energy Assistance and gave us some information on that. So definitely take a look at that in case you guys have anyone that might need that.
Excellent. Are you going to send out all of the PowerPoints post meeting?
Mostly it's been websites. So if you look in the chat, there's websites and contact information. So feel free to grab as much as you'd like.
Excellent. Thank you. And I see that Mudwella from Community Advocates is after me. I might stick around to hear him.
Yes.
Yeah.
Yes.
I don't think I've ever heard him present. I think I'll stick around.
Maria, will we be able to have a copy of because I see it's being recorded, will we be able to access this one as well?
Julie. Hold on. Julie would be able to tell us. Julie. She might have stepped off for a second.
Yeah, she's still getting her coffee. Thanks for reminding me it's being recorded, though. That just adds another layer to the whole experience.
Sorry.
No, that's okay. If it ends up being halfway decent, you could use it again, right? Although you want to be available for questions. So I am going to leave some time for questions and pause after each topic just to see if there's questions about the particular topics.
She'll let us know, but I believe that they are recording it for that purpose, but I can see what she's doing with these.
Mm-hmm.
All right, Liz, the floor is yours. So everyone should be back. I'm sure you have your fresh cup of coffee, getting your lunch ready in the oven or however you're cooking it today. That's the best part of working from home is that we can get some of those things done in between. We have Liz from Sojourner Family Peace Center here today, so I'm going to turn it over to Liz.
Thanks, Maria. Thank you so much for having me. I'm going to use a PowerPoint just because it'll help keep me on track. And I'm going to make sure I keep an eye on the time because I've got until 11:20, right? Yep.
11:25.
Okay. All right. Here we go. Am I sharing my screen?
I don't see it yet. Hold on. Yep, there it is.
Okay, excellent. So we're going to talk about when you realize that there is a family you're working with that has a history of domestic violence. We're going to talk about how we define domestic violence. What are some of the warning signs? What are some of the barriers to asking for help? How you can approach the subject, things you need to keep in mind. And then we're also going to talk about your safety and well-being and how you interact both with the family will keep you safe and how you pay attention to taking care of yourself will protect your well-being. At the end, I will go over resources both locally, statewide, and nationally. So don't worry about knowing where to refer someone who needs help. So we're just going to get started. When we're talking about domestic violence, we're talking about a pattern rather than a single incident of abusive behaviors. It can be either adults or adolescents, and we're talking about intimate partners. Although all of the programs in Wisconsin will also provide support to someone who's being abused by a family member or a caregiver. And we're actually seeing right now that there's an awful lot of family violence that's not intimate partner violence, probably related to folks being at home and not getting a break from one another and not having any other way to get away when they're unsafe. We talk about domestic abuse as characterized by one partner's need to control the other and the intentional use of tactics to secure and maintain control, and that it causes harm, physical, emotional, sexual, psychological, that it is causing harm. Warning signs are the actual physical abuse, but also threats, very jealous or possessiveness in the relationship, accusations of being unfaithful, using or threatening with a weapon, financial abuse, controlling money, and not respecting the other partner's feelings, including put downs, isolation from other potential sources of support, sexual abuse, withholding or preventing you from getting medical care treatment, acting as though your opinion is not important and making decisions without your input, destroying property, threatening to kill themselves. Often someone who is making threats to kill themselves also don't have much respect for anyone else's life, and that can make them much more lethal and potentially homicidal as well as suicidal. The getting angry when drinking alcohol or using drugs is often an excuse. There's a saying that, you know, if an abusive drunk gets sober, then they're still abusive. That they're separate issues, but they're very related. It also makes the situation more dangerous because alcohol and drugs can lower inhibitions, can cause escalated violence that's not intended by the person using the violence. So they might accidentally hurt their partner worse than they intended because of the alcohol or drugs. So it's a pretty complicated issue. A victim who is being harmed by a partner is aware that trying to get away from the abuser can be more dangerous. So there's the fear of more harm coming to themselves or their children if they do ask for help. And often the abuser plays on that and says, if you tell anyone, I'll hurt you. If you try to leave me, I'll kill you. If I can't have you, no one else will. Often there's either an implied or an explicit threat to the children as well. That something that the abuser will do something to the children if the victim tries to get away from them. There's also fear that a separation from the abuser is going to have a negative financial impact, and it's true that survivors who leave abusers often suffer financially. They're afraid they're going to lose custody of their kids or access to their kids because, again, the abuser is either implicitly or explicitly making threats about what they'll do to harm either the relationship or the access to the children. Threatening to call CPS, threatening to accuse the victim of child abuse, that sort of thing. They're also afraid that people will blame them in their circle and that they will be seen as at fault or failing to keep the relationship together. Loneliness is a huge motivator. Right now, we're all pretty socially isolated, but being more socially isolated can be a barrier to asking for help. Not having a support network that's actually supportive. Fear of being a single parent can be pretty powerful, and sometimes one's own cultural, religious communities frown upon separating from someone, even if there is abuse, and there could also be immigration or other legal repercussions for some victims. But just as powerful as all of those things that victims are afraid of is the hope that things are going to change, that there's going to be safety in their future and that they're going to live happily ever after. It's a pretty powerful thing. And very often in an abusive relationship, there's a cycle that after an abusive incident, the abuser is particularly loving and attentive, which raises the victim's hope that's how the relationship's going to be. And often there's lots of promises. I won't be violent anymore. I'll get treatment for my substance use. The thing that I'm using as an excuse for being violent is going to be taken care of, so I won't be violent anymore. Often that cycle is especially pronounced when there's a criminal charge pending against the abuser. So there's lots of marriage proposals from jail, for instance. There's additional barriers for victims whose immigration status relies on the relationship with the abuser. If there is battering in a same-sex relationship by someone who's older or younger, persons with disabilities, including temporary limits like pregnancy, or if the abuser is particularly well-known, a pillar in the community, perhaps works as a faith leader or police officer, those things all make it much, much more difficult for the victim to reach out for help. The victim status is if that person works in a stigmatized profession, if they're in sex work, or if they have other things they don't want their friends and family and community to know about them. So some of these things are about the abuser holding some stigmatized aspect of the victim's life over their head. So if they're not out to their family as LGBT or Q, the abuser might use that as a tool, a manipulative tool to keep the victim in the relationship. So I'm sure you've heard the term trauma informed. We want you to think about what has happened to the person who is displaying a trauma response instead of what's wrong with them, or why didn't they make better choices. So when speaking to victims, don't minimize the impact of the abuser on the children, or make jokes or laugh when they can hear you doing it. I know that, you know, many of us like to have fun at work with our coworkers, but if victims hear us making jokes and laughing with our coworkers, they think that we are making light of the situation and of the work that we do. Don't blame the victim or ask like what they did to cause it. Don't trivialize or minimize it or make, if someone discloses abuse to you, don't make it seem as though it's not a big deal. Think and talk explicitly about how you're going to support their need to be safe in the future. And don't violate her confidentiality. And if you have limits to what you can keep private, make sure that you have the conversation about what's private, what's not, what can you keep confidential, and what do you have to report. So be very conscious of your words, and even beyond your words, your attitude and your underlying beliefs. They can make a difference. They can positively impact your relationship and your effectiveness, but they can also negatively impact the survivor if they pick up on judgments you're making, negative beliefs, or attitudes about them or their situation. We're going to talk a little bit more about what's available in Milwaukee in terms of domestic violence agencies, but explore what's available to them in terms of support beyond just agencies, but what's their support network? Who can they turn to if they need help, or if they need someone to talk to, or if they need someone to help them figure out how to get safe? Ask them if they'll be safe when they leave the conversation with you, and appreciate them if they're confiding in you very personal things. So acknowledging the risk really shows that it's interesting. Very often victims, when they're telling their story, get a reaction that doesn't focus on ongoing risk, the fact that they might be hurt worse in the future. There's some research out of Dr. Jackie Campbell's work. She developed both a danger assessment and a lethality assessment to determine what factors make someone at greater risk of being killed. And what her research shows is that when you explicitly call out the fact that there's a risk of homicide for someone who is at very high risk of being killed because of the factors that are present, it actually makes a difference. It helps them to connect more strongly with services that can be protective over time. So it was a shift for Sojourner to say to victims who are high risk, people in your situation have been hurt or killed, and I'd like to talk with you about what your risk looks like. It seems rather blunt and sort of, maybe a little exaggerated, but it does actually work. And really what's underlying much of our concern is that we're afraid that someone we're talking to is going to be killed. And if we don't call that out and acknowledge the real risk of being seriously harmed, we're doing a disservice, really. So also listening to victims and their children gives the possibility that some intervention crafted will interrupt the abuse and stop the escalation of the violence. Not calling it out makes it seem that we think it's acceptable. So the message that abuse is unacceptable is a super important message. It reinforces that our community doesn't tolerate abuse and that we value them. So as I said before, your personal biases are communicated, even if you don't explicitly call them out. People will pick up on them. You need to do your own. We all grew up in a culture that blames victims for what happens to them. So it's important to think about that and to do your own work. Our culture has a double standard that harshly judges mothers and assumes that fathers are not responsible for children. And many of us also have our own experiences of trauma, of witnessing abuse, or of being abused that add to the mix. So if you are afraid of what's happening in a situation, it's an indicator that it's touching something in you that from your own experience. So it can be there can be a higher risk of burnout if you don't do your own work. If you are a survivor, pay attention to when you start to identify too strongly with any one family member. If you're either judging them too harshly or feeling too much empathy for them, you need to remember that there is a process. Things don't happen with the flip of a switch, and that it's not your responsibility to fix everything, but to be a safe person. So often there's lots of pressures impacting survivors. Not only is the abuser telling them the bad things that will happen and making promises that are manipulative, but they also have messages from friends and family, often in court, family court, children's court, CPS hearings. There are other pressures impacting them. Law enforcement is a pressure, school and work. And we believe at Sojourner that victims really are constantly assessing what is the safest thing to do. Victims want the violence to stop and the relationship to continue. And a lot of times people have really crummy choices. Either I do this one thing that's going to cause some bad things and some hard things to deal with, or this other thing that's also bad and hard to deal with. Abusers are always trying to get the upper hand and get sympathy and manipulate all of us. And if you start to believe that, the victim that you're talking to is going to pick up on the fact that you're starting to believe the abuser's narrative. So it's also true that you can't tell a victim or an abuser just by looking at them. They are among us. Statistically, it's not possible that you don't know victims and that you don't know abusers. And some abusers have particular advantages, whether it's access to resources, a family with money, a high-paying job, or visibility in the community. They might be highly religious. They might use cultural excuses or narratives to maintain their position of authority in the family. And anything that makes them sympathetic or gives them additional resources is going to make the situation more difficult for the victim. So be open to the conversation. Give your full attention. Don't seem distracted. People are not going to want to tell you what's going on if they believe that you're checking off a list in your head or filling out an intake form, right? Be emotionally present. Do more listening than talking. Use kindness and dignity. Care about their lives. Talk with them about what else is happening. It does make a difference to have a connection with folks that's a personal connection. If you are afraid of what's going on in the situation for your own safety, examine your own biases about whether or not you're really safe, because the truth is that you are more safe if you're respectful and if you are treating folks with dignity. Especially be aware of your own reactions based on all the isms: racism, sexism, heterosexism. If working with an abuser makes you fearful, this is what I just said, disrespect, whether it's real or perceived makes you less safe. So be particularly conscious of whether or not how you're behaving could be perceived as disrespectful. If you find yourself getting angry, there's a good chance that you're also afraid. Super important for anyone doing any sort of supportive role, people are going to say hurtful things to you. Don't take it personally. It really isn't about you. It's about what's going on for them. Try not to let that color how you respond. They expect you to be judgmental because that is the default that they run into the world. So suspend your judgment, listen, be open to learning about their experience. So I have to give credit to a woman I used to work with, Miss Victoria. She said that her strategy when there was a situation that seemed to be volatile was to use the 3 C's, which is to remain calm, remain calm, remain calm. Think in advance how you're going to calm yourself if there is a situation. Strong emotions are normal, but people will know if you're afraid and if you are not calm, and it's really going to escalate the situation. It's going to ratchet it up. If everybody is having a difficulty regulating their emotions, including you, it's likely to go downhill from there. It's normal to get upset or angry, but try to be a calming present and not to move towards a goal, but to just hold the space and be with them. Some of the things that are particularly hard not to be judgmental about is if the parents are not supposed to be having contact, and you find out they are, you may be thinking, well, that's a really bad choice. Again, if you have limits on your confidentiality and whether or not you need to report that, be clear about that up front. But if it is not something that you need to take action on, try not to be judgmental about the fact that they're having contact. That often is a safety strategy for victims because not having contact makes them imagine that things are worse, and they believe that if they talk with the other parent, if they talk with their abusive partner, they can at least know where they're at. They can know where they're at emotionally. They can know what's going on in their lives, and that will actually be safer for them. Don't diagnose or pathologize. Treat their experience as though it's pathological. Don't say this is how you need to respond. You must call the police. You must get a restraining order. You must get into counseling. Unless that's your role, prescribing solutions can really be counterproductive. Don't gossip. Don't pry. Don't treat the families. It says using the visitation center. It's a PowerPoint I've used for the visitation center workers. Families will know if you're gossiping or wanting to know the salacious details for reasons other than providing support. Remember that many of the things that families experience that make it look as though they're challenged is really a result of the abuse and the other things that have happened to them, rather than because there's something wrong with them as a family. So there is research that shows that both victims and abusers are motivated to make positive change that enhance safety and hold the abuser accountable if they are aware of the negative impact it's having on their children's lives. And if they know that their children are being harmed by the abuse, that is a motivating factor, like I said, both for victims and abusers. It's important to meet folks where they're at. You're probably going to hear that from other presenters too. It's a concept that's difficult to do, but important. If you or someone you know has escaped an abusive situation, realize that the way that happened is not the only way or the right way. Everyone's path is a little bit different. There is no magic formula for the things that you need to do to get out of an abusive relationship. So a couple words about abusers, because like I said earlier, all of us know victims, all of us know abusers. If we are treating an abuser with disrespect or not with dignity, it actually not only is unsafe for us, but also just reinforces abusers' belief that everyone in the world is out to get them. And it's counterproductive. It does not help the situation. Accountability does matter. Earlier, I talked about the research that an awareness that children are being negatively impacted is often a motivator for change. We also know that being held accountable is also a motivator for change for abusers. So being arrested does matter. And it does matter the first couple of times until it becomes, I'm, getting arrested 5 or 6 times, the effect sort of wears off. But we know that being kind and firm and saying this is not allowed and there are going to be consequences does matter for abusers. Again, change is a process. Abusers can be extremely charming. Especially when they try to flip the script and say, really, I'm the victim, the person I'm hurting is the one hurting me, they can be extremely convincing. They're used to getting what they want. A lot of people say, why do abusers do what they do? And they do it because it gets them what they want. They're used to getting their way that way. And they believe that they have a right to it, and they have an extreme sense of entitlement. Just be aware that you're not giving someone more authority or credibility because of a privileged status that they hold. So do respectfully express your concern and say that you're worried about someone. It might not be sort of the natural thing to do in a professional relationship, but it really is important that you say, I'm really worried about you. I'm really worried about your safety. And remember that legal remedies are not always 100% effective 100% of the time. It doesn't automatically mean someone's going to be safe from now until forever. If I call the police, it actually might make me less safe for a short period of time. A lot of protective measures that a victim takes can increase their risk. If you look at domestic violence homicides, you'll see that there's a pattern that very often the victim was trying to get away from the abuser. There might be a divorce pending or a restraining order or custody hearing, or the victim was talking about leaving or making plans to leave or saying that they wanted to separate from the abuser. That often increases the risk. So be careful that you're not prescribing just leave, because it's important that safety is taken into account as someone's making a plan. Resist the urge to have those solutions as a fix. It's a lot more complicated than that. So try not to be has all the answers. It might seem counterintuitive that you shouldn't tell people to leave because that is what we think is going to make people safe. But as I just mentioned, it doesn't actually make people safe, and having them make their choices, even if they scare you, is important to support. So let's talk a little bit about self-care, because it can be super scary, and it can have a toll on all of us to hear about what folks are going through and to feel helpless to fix it, right? If you don't take care of yourself and you don't take care of the stuff that comes up for you, it can impact your sense of safety, trust, how you feel about yourself, how you feel about the world, whether you're able to emotionally take care of yourself. It can impact what you think about your spirituality, your personal life, your relationships. Who you are really can be impacted. And you can get burnt out. You could be uncharacteristically short-tempered or frantically trying to fix things. You could have intrusive thoughts or unhealthy coping. or whatever else indicates that you're just not yourself. So be present and be kind to each other, and be non-judgmental with each other. Don't take it personally. Earlier I said don't take it personally if a family is not nice to you. Don't take it personally. If your coworkers are having a bad day, don't gossip about them. Remember to treat everyone with respect and dignity. Have fun as long as you're not doing it within earshot of someone who might think that you're taking light of their situation. And again, remain calm, calm, calm from Miss Victoria. So let's talk about resources for a little while. I've got a little bit of time left to go through the resources, and then I'm going to take some questions. So Milwaukee has 2 emergency domestic violence shelters. Sojourner Family Peace Center and Community Advocates runs the Milwaukee Women's Center. In addition to domestic violence shelters, there are also homeless shelters, and the entry into homeless shelters is coordinated by 211. Sojourner and Community Advocates both run a hotline where we also screen requests for shelter. I think you're going to hear from Manuela from Community Advocates next, so I'm not going to talk a lot about their programs other than to mention they have an emergency domestic violence shelter, as does Sojourner Family Peace Center. Both of us run a shelter that is gender inclusive, meaning that anyone who is a victim, regardless of their gender, can stay with us with their children. So historically, we served primarily battered women and their children, but we also serve adult men and their children, non-binary folks and trans folks. Sojourner also helps people file restraining orders, and that phone number is listed. Like I said earlier, you'll get a copy of the PowerPoint so that you've got all these phone numbers. And the hotline is also where most folks should call, regardless of what kind of services they want to access. We have advocates in the police districts. We have advocates who work with the prosecutors who can help folks whose abuser is being prosecuted. We have support groups and healing services and relationships with other agencies who share a building on 6th and Walnut with us. So we can help people get access to all of those services through our hotline. I've also got our administrative number up here, but most folks would be calling the hotline and they can get transferred to anywhere within the agency they need to talk to. There is also LGBTQ specific support available in Milwaukee that also includes anti-violence programming for survivors of hate crimes. The Milwaukee LGBT Community Center has an anti-violence program, and Diverse and Resilient has a Room to Be Safe program with a phone number where folks can talk to someone if they have a strong identity as an LGBTQ survivor and they want to talk with someone who understands that experience about them. There are also culturally and linguistically specific support programs. At UMOS, the Latina Resource Center offers services to immigrant survivors, including in Spanish. All of us will use a translator if it's a language we don't have on staff. The ASHA Project does culturally specific programming for African American survivors, but they also will serve other survivors as well. The Milwaukee Muslim Women's Coalition has a new program called Our Peaceful Home, and they serve Muslim women in many languages, and they have a pretty deep linguistic bench there. The Hmong American Women's Association serves Hmong and other Southeast Asian survivors, not just women, and there is a helpline available after hours. Sojourner also has a program for Russian-speaking victims. Statewide and nationally, there is a statewide hotline, email, and text by Deaf Unity Wisconsin. They serve survivors from the deaf community. Unidos is a statewide program that serves Spanish-speaking survivors. And then there's a national domestic violence hotline and a national sexual assault hotline. Both of those hotlines refer folks back to their community, but they can also take anonymous calls and talk to someone without knowing their personally identifying information. sexual assault specific if the person that you are referring for support has been sexually abused, and that is one of the primary reasons they want support. There is crisis and non-crisis services. So sexual abuse for non-crisis is the Healing Center on Bruce Street. And Aurora also has healing and advocacy services with a hotline that's available 24/7 and a text line that used to be called Sexual Assault Treatment Center, if that's more familiar to you. So I'm going to stop sharing, and I'm going to see what kind of questions came up during that presentation. And I hope I stopped sharing.
I have a question.
Mm-hmm.
So you talked about like immigrant women being afraid of reaching help because of their immigration status. So does Sojourner or any other place do anything about that? Like, do they try to protect them, or like, doing something that doesn't affect that?
That's a really good question. So let me back up and say that none of us will ask folks about their immigration status. So if someone is afraid that they're going to be reported if they are undocumented, that will not happen, right? We are all free, we are all confidential, and we all serve anyone who's a survivor. So let me just start there. The second thing is that survivors have lots of complicated issues, including legal issues and immigration issues, where an advocate cannot give advice, but can help connect to someone who can give legal advice in particular. So we do have relationships with attorneys who can advise someone about immigration issues at Legal Action, at Lotus Legal Clinic, at Catholic Charities. So we do have lots of relationships, and we would most definitely help a survivor who had questions about how to navigate that system with someone who could actually give them legal advice. We're just pretty careful that we're not giving legal advice when we're not qualified to do so. Did that answer your question?
Yes, thank you.
You're welcome. So normally, I don't know if you heard Maria and I chatting before the presentation started. Normally, I would have invited you to our building on 6th and Walnut, and we would be in a conference room, and we would be taking a tour, and I would be showing you around and talking about the partners that are in the building, as well as more in depth about our services. I invite you all to come visit when it's possible again, and when there aren't limits on socially gathering. Right now, our conference rooms are closed, but you're all welcome to call me, email me, tell me there's something else you want to know more about, and I will show you pictures of the building if you want, and I'll give you a tour when we're able to do that again.
Thank you, Liz.
You're welcome.
If anyone has any questions, please feel free to ask. Other than that, we have a 5-minute break, and then we should have our presenter from Community Advocates come on and give you guys some additional information.
Great. Thank you.
You're welcome. Manuela?
Hello,
Hi, how are you?
I'm good. How are you?
Good, good. I'm Maria. I'm the one that's been emailing back and forth with you.
Oh, very nice to meet you.
You too. We have them on break until 11:30, and
Okay.
then they'll be all yours. We have about 23 people in the training, and some community partners that have stayed on as well because they're interested in just hearing the updates on community advocates, which is really nice. So yeah, we're really excited to have you with us. And yep, there's Liz, and then Cleopatra's here also from Energy Assistance, and I believe those are the two that have stayed on.
Hey, everyone.
Hello. So what I did is I actually just have a printout of all of our services,
Sure,
our program list, and I'll just go through that list and it
that's
kind of
fine.
give you information on contacts and things of that nature.
Okay. All right, we have about another minute or so.
Okay.
Are you guys mainly in the office or are you guys working from home?
It's a mixed bag. I think we have 24/7 facilities, so of course they're all working in the office. For those that work in the office locations, we probably have about 20 or 30% in the office.
Okay. All right.
So,
Yeah, we're pretty much home right now, but then like I go out in the community all the time, so my day's all over the place, but mainly in my car. But today I'm at home. All right, so everybody should be back and ready to go. They probably went and got another cup of coffee, or did some stretching, so they're all ready for you. Oh, you're on mute. I can't hear you.
all right. Is this better?
Yes, I can hear you.
Okay, good. I'm sorry. There's always technical difficulties, right, when we do these things. All right. Well, good morning, everyone. Again, I'm Manuela Kirkendall. I'm the Chief Operating Officer here at Community Advocates. And I am going to just kind of go over a list of our services. We have quite a few, so I'll gloss over some. I know that Ms. Eccles has gone over energy assistance. So I do have that in my slide presentation, but I'll kind of just kind of go over that, I guess, or kind of gloss over that as well. But I'll go over everything else. And so I am going to share my screen. Let's see how we do this here. And can you see this?
Not yet.
Not yet. Okay. Nothing still?
No.
Of course. Let's try one more thing. I have this entire thing all set up and ready to go.
Of course. This is how it usually goes.
Oh, wow.
If you want to email it to me, I could also try putting it up on the screen if that helps.
Okay, yeah, I'll do that.
Okay.
All right, so I just sent it, but I'll get started.
Okay.
All right, so as I mentioned with Community Advocates, I've been here at Community Advocates for 21 years and worked in just about every department within our organization. And Community Advocates is broken down into 4 different divisions. So we have our Basic Needs Division, we have our Milwaukee Women's Center Division, we have our Behavioral Health Division, and we have our Public Policy Institute. I'll start off by talking about our Basic Needs Division. As I mentioned, I saw that Ms. Eccles was on she presented, so energy assistance. So I'm assuming she's gone over everything in detail like she always does. I think I'd just like to highlight, again, I think the program is funded by the Department of Administration. It's under Division of Decker. And Milwaukee County is the recipient of the grant, and Community Advocates and UMOS and Milwaukee County partner on that particular grant. And again, I think the key with this particular program, with COVID specifically, we are not seeing customers in the office. So we encourage individuals to call our phone line at 270-4653 or applying online at keepwarmmke.org. So you'll see that in the paperwork, the documentation once you guys get it. Now, I'll spend a lot of time, because I think one of the big needs we see often is our housing department. We do a variety of services around tenant landlord issues, anything from, finding housing, dealing with tenant landlord discrimination cases, landlord not giving the security deposit back, to not make a repair. So we contract, I'll just kind of go over some of our services. We contract with the city of Milwaukee, work very Department of Neighborhood Services. So tenants who are in properties where the landlord is not making repairs, we work with the city building inspector and the tenant to force the landlord to bring the property up to code compliance. We do that several ways. We have a rent withholding program, so tenants can pay their rent into the city rent withholding account. And then we also have rent abatement. So rent abatement is a program where we actually can help the tenants legally withhold a portion of their rent. Why that's important, of course, when you have landlords that don't want to make repairs, this is a very strong incentive for them to get the repairs done. So if they don't make repairs, they lose money. The interesting thing is with the rent withholding program, if once there's enough money in the account, we can hire contractors to make repairs on those properties. We serve about 400 to 500 households a year in that particular program. I think our largest program in our housing department is our homeless prevention program. We actually partner with several different entities, Milwaukee County being the main partner right now, but we also partner with the state of Wisconsin, City of Milwaukee, United Way, and a couple of other smaller foundations. And basically the homeless prevention program is one where we assist low-income renters, individuals, and families who are at risk of losing their house. But we basically provide a full assessment of the family. So we don't look at just a child. We use a two-generation approach. So we're looking at child and parents to determine what the needs are to best stabilize that household. We can provide things like rental assistance, security deposit assistance, as I mentioned, tenant landlord mediation services, rental arrears services, and a wide array of, basically any tenant landlord issue, we can assist them with that. But I think the key, most individuals that come into our office for this service, they're typically behind their rent a month or two. And we work to make sure that, we're able to provide them with that assistance so that they are able to maintain their housing situation. There are instances, of course, where the landlord does not want that person to stay. We will assist them with relocating to another property and, again, providing that security deposit and rental assistance to that family. I mean, oftentimes we see individuals coming through our doors quite often. So those individuals are referred to case management services. So, we have a situation where someone may have just lost their income for 1 month. And of course, they don't necessarily need case management, but we have those families that we have seen in our shelter system, cycling through other services, whether it be emergency assistance, our services, or other housing provider services. We will link them with the case manager. Generally, the case management will last up to 6 months. And again, we talk with those families about budgeting, making sure the children are, going to school and things of that nature. Another program that we have, we work very closely with the health department. So we have a lead abatement relocation program. So families that are in properties where their child has high or elevated lead levels, we assist those families with relocating into temporary housing until the lead is remediated. We actually, new partnership is we are purchasing properties from the city of Milwaukee. So these families that are impacted by lead will be able to go into a residence that's fully furnished and have assistance with, of course, making sure there is no instability in the household until the repairs are being made at their particular property. And again, that's a close partnership we have with the Milwaukee Health Department Childhood Lead Poisoning Prevention Team. The next program I'll talk about briefly is our permanent housing program. So again, as I mentioned, we have a lot of families that we are seeing cycling through the shelter system, leaving one shelter, going to the next. And we work closely with all of the shelters to identify these families and place them into somewhat permanent supportive housing. And so we provide case management for these families, furniture for the families, and then also, of course, getting them into the property. We need to help them with paying rent, get them rental assistance, things of that nature. One of the things that happened because of COVID is there's a lot of funding now for families and singles who are experiencing either homelessness or if they're experiencing a situation where they're at risk of being homeless. So there's funding for those families. This particular program will, again, ideally for families that are kind of chronic users of the system. And we can link them with the case manager, and generally that case management can last up to a year. Some of another program we've had for over, since I've been here 20 plus years, our rent bridge program. Oftentimes, and right now is not one of those times, families cannot afford to pay rent and security deposits when they're looking to move into another property. And it's always a struggle. I mean, considering the income may be, sometimes as low as $700 or $600 a month. So what we've done is we've worked with several landlords who will allow these tenants to pay their security deposit or rent, if they're behind their rent, up to over a 6-month time period. And so generally, if an individual is looking to move into a property that's, say $650, we'll set up a payment plan between the tenant and the landlord, and we basically are the co-signers of that payment plan. So if the tenant does not pay, we will pay that, pay the balance that's owed. Let's see here. Oh, so one of the most recent ventures, and this is a true partnership with a lot of organizations. There were over 30 plus organizations at the table when this was being developed. It's been two to 3 years in the works. We are opening the first rental housing resource center here in Milwaukee. There are some throughout the state. Madison has a really nice one. So we are at our location on 7th in Wisconsin. We'll be opening that location. Construction actually starts the beginning of next month, and we hope to have it open on January 1st. And basically what the resource center will provide is legal services. So we will have attorneys on site, mediation. We'll have our rent payment assistance programs all in one location. So it will be truly a one-stop shop. We partner with landlords. So the apartment association, some of the larger landlords like Barada Property Management, all of those folks are on board and are looking to participate in the rental housing resource center. And the hope is that we prevent families from going from home to home. In Milwaukee, what we know is that a lot of our low-income families may move 3 to 4 times a year. And, for children going to school, that just disrupts a lot. And it definitely doesn't help in terms of grades and disciplinary action and behavior. So I think this will be one step in the right direction. It's been a long time coming. But as I mentioned, we're going to have, the housing services, but we'll also have services like employment, food share, other mainstream resources at this location. So I'm hoping to make this a very seamless connection of services. So look forward to more to come in January for that. And as I mentioned, I mean, I think, again, we talk about, we often focus on the parents in the household in terms of homelessness and need of housing, but we don't look at the children. And one of the programs that we started almost 5 years ago, and was a partnership with United Way and another private foundation, was our Seymour Family Homeless Prevention and Case Management Program. So the goal of that program is to reduce student mobility and increase academic success by improving long-term housing and economic stability for low-income families with school-aged children. We spend a lot of time with these families working on just kind of providing the wraparound services and linking them to mainstream resources. And of course, with the goal of keeping them in the same property at least throughout the entire school year. And we've seen dramatic increases in attendance, dramatic increases in grades, and decreased activity in terms of behavioral suspensions and things of that nature in the school system. That is one program that we are expanding. We just received a grant to increase, basically double the case management staff for that particular program. And we're actually now in all of the community schools. So Milwaukee Public Schools has a subset of schools that they have deemed neighborhood community schools. So we are in those schools now, working directly with the social workers and the teams there to kind of, again, stabilize those families. There's one particular school that we're working with where the exit from the school is basically at 50% now. So we have families that start school at the beginning of the year, and at least 50% of the students are no longer in the school. And that's a particular school that we're targeting and hoping to, of course, turn things around there. And of course, the outcome hopefully would be that we have increased grades and things of that nature for those students. We provide tenant landlord trainings in the community. That particular program has kind of ceased because we're not out in the community, but we will provide online virtual trainings if individuals are interested. And you can contact me directly if you are. And then also under our our basic needs division is our disability services division. We provide what is called IDAP, Interim Disability Assistance Program. And for individuals that are applying for SSI, SSDI, of course, because the process is so long, we are able to provide them with a very small stipend monthly until the decision is made on their case. And generally, the max that we will provide that assistance is 18 months. And in terms of the dollar amount, it's roughly $205 a month, which doesn't seem like a lot to us. But what we're learning is that $205 can get someone somewhere to stay, if they're sleeping on someone's couch, get them to their medical appointments, bus fare and things of that nature, just so that helps to kind of keep that stability to a certain degree so that they can continue to go to their doctor so that their case will be heard and approved by disability. Excuse me, their case will be approved. We also provide protective pay services. So again, individuals that are receiving SSI, SSDI, and they are required to pay, we provide that service. There's a small fee for that service. And then when you get the paperwork, you'll have the contact information for the individual that is in charge of that particular program. In terms of the paid services, what we do is we make sure that their rent's paid, all of their bills are paid upfront, and then we provide individuals with sometimes a weekly allowance. It really depends on that individual's circumstances. And so we do that as well. So that program has been around before I started here at Community Advocates. And just briefly, we also do some SSI advocacy for hospital systems. So we're in Kenosha. And so they refer families over who are in need of an SSI application and representation, and we do that for those individuals. So we partner with Children's Hospital, Managed Health Services, which is the HMO, and the Kenosha Department of Human Services. And lastly, under our basic needs division is our Food Share Employment and Training Program. So that's FSET. So we currently contract with the Maximus to provide that service. And again, the key around that is just providing employment assessment tools for job seekers. So whether it be job referral, skill assessment, career planning, job training, we can do all of that here. We have a employment center, so individuals can come here and we can assist them with their resume building, and then provide direct links to employment opportunities. We also, generally we were having them every other week, but we have on-site job fairs. And so individuals can come to our location, and most of the employers that we would have here would be hiring on the spot. And the range generally would be between $13 to $17 an hour for these jobs that were here at our location. All right, quickly, I'm going to, let's see, 7:40. All right, quickly, and then our behavioral health division, we have a safe haven. So on 34th and Lisbon, we have a building for chronically homeless individuals. So people that generally you would see maybe sometimes living on train tracks, bus shelters, things of that nature. They can be referred into our safe haven, and they can stay in there for approximately 9 to 12 months, sometimes longer, sometimes shorter. And the goal for that particular program is just to kind of get them off the streets. We don't require a lot. We don't ask them to stop drinking or using drugs or doing anything like that. We just want to get them inside and get them acclimated with having somewhat of a normal life. And then once that happens, we are able to transfer them to our permanent supportive housing program. So we have 100+ units throughout the city of Milwaukee, north and south side, where individuals they don't have to necessarily leave Autumn West, but generally most people that leave Autumn West go into our program, but they can be referred from 211. And we provide them with a fully furnished apartment. And generally, the most they would pay would be 30% of their income. It is a HUD subsidized program. And they have basically the same case manager for the entire time. The person either stays employed with Community Advocates or the person stays in the program. We've seen a lot of great success with this particular program. A lot of people that, again, had been on the streets for 10 or 15 years, now actually working and actually transitioning out of our program and going into the general Section 8 housing. Another partnership we have with Milwaukee County is the My Home program. So it's basically similar in that it's a tenant-based rent assistance program for individuals and families who are homeless, disabled, and we are now working with veterans. And our role is to provide them case management and housing stability services. Referrals for that program will have to go through Milwaukee County Division of Housing. All right, the next division is our Milwaukee Women's Center division. We have actually 2 shelters under this division. So we have a domestic violence shelter and we have a family shelter. And within that shelter, we have another program for older abused women. And so we generally house up to 75 individuals. So that's men, women, and children at times. And generally the stay is between 30 and 60 days. And during their stay, we assist them with getting linked with mainstream resources, employment, as well as looking for housing options, whether that be Section 8 housing, just general permanent housing or permanent supportive housing, or rapid rehousing services. As I mentioned, due to COVID, there's a lot of new funding for families and singles that are experiencing a housing crisis. And the best way to get to those services would be to go through 211. Let's see. We have a children's programming. So at our shelter, families, of course, it's kind of a traumatic experience for children who are being uprooted from their home at times, sometimes violence. And so one of the things that we developed was a children's program. So we assist the children with kind of dealing with that trauma. We have therapists on site that work with them. We also provide mentoring, tutoring, and right now, due to COVID, we're actually providing schooling at the shelter. So we've set up a little makeshift school there, and children are attending class at the shelter. Also, crisis lines. So women and sometimes men who are experiencing domestic violence can call our crisis lines, the 24-hour line. The phone number is 671-6140. And basically, we will work with individuals to kind of develop a safety plan if need be. Sometimes it's just a matter of they want to call and talk. We will provide whatever services needed, and we partner very closely with Sojourner Sojo on this endeavor. So, and we make a lot of referrals back and forth. All right. Also under that division, we partner with Milwaukee County Pathways for Fathers and Families. So it's a program basically designed to strengthen positive father-child engagement, improve employment and economic mobility opportunities, improve healthy relationships and marriages. So we identified a huge gap some time ago where, we're dealing with generally the mom who's been abused, but we know that oftentimes the mom would be going back to the husband, boyfriend. And so we thought, okay, we need to be developing services for those men who will, of course, oftentimes be back with that mom. So we have the fatherhood program, but then we also have Nevermore Batterers Treatment Program. So the men can attend our sessions and kind of work through some of their childhood trauma generally. And that's generally a 16-week program. And so we kind of talk about things around healthy behavior, controlling your behavior, looking at the root causes of the abuse and things of that nature. Very successful program. Over 80% of the men that complete that program do not reoffend. So very successful program. And the phone number for that individual that's in charge will be on the paperwork that on the document that they'll share with you shortly. We also provide substance abuse treatment and recovery programming. So at our location on Fond du Lac, 4906, we have a treatment facility there. It's day treatment, and there is no charge. So any woman that is in need of services can simply walk into our office, and she'll be screened for services, and we'll link her with a counselor. Again, that particular program, because of COVID, is shut down at that location, but we are still doing things virtual. So there is still ongoing services. And from what I'm being told by my staff, that the needs are increased almost twofold since COVID has been in existence. So And then lastly, I'll just briefly talk about public policy. So over 10 years ago, we kind of looked at, we continue to see the same individuals in need of services. And how do we upstream develop policies that will prevent them from having to come through our doors? So we've partnered with a lot of local, state, federal politicians and legislators on different things. So I'm just trying to think. So we have a drug-free community projects. We work specifically in the 53206 zip code, which includes Lindsay Heights and Milwaukee Amati neighborhood, and several different initiatives that we work on in that, just around drug prevention. And we don't go in the neighborhoods attempting to take over. We work closely with whomever is there to support their efforts. We do a lot of conversations with policy leaders. So we oftentimes have events here at our location, just kind of bringing in politicians from both sides of the aisle and kind of talk about how we can collectively address some of the concerns and issues within the city of Milwaukee and the county. And let's see here. One of the big things we're doing now in public policy, and then I'll stop so we can ask questions, is our Healthy Housing Initiative. So it was developed to create specifically a look at the assessment of healthy, high quality, affordable, stable housing, and how health is being impacted by the fact that we don't have a lot of healthy housing, a lot of safe housing. And so there was, again, a big effort of over 30 plus organizations coming to the table over a year. And basically the hope is that we will change the narrative and figure out how we develop a system that eventually builds and sustains affordable, safe housing. And again, a lot of that is going to be through having the individuals that are impacted, so consumers, tenants, involved with that process. And so we've had pretty good success with that. And then lastly, I'll just talk about our Milwaukee Brighter Futures Initiative. So basically, again, we talk about collaboration. This particular initiative brings together networks and programs to work collaboratively on building trauma response, strengths-based youth programs, specifically around substance abuse. And the age range is 12 to 21. So we actually, not only do we receive funding from the state, we actually are a funder for several organizations here in the city of Milwaukee. And we do a lot of work out of county as well. And lastly, our transitional jobs program. So we spend a lot of time just trying to figure out, the key with a lot of this is like getting people employed. Hello? Hello?
Now we can hear you, but it echoed.
Oh my goodness. Wait. At what point did I lose you guys?
You were just starting to talk about transitional jobs and how most of this is about employment.
Okay, I'm sorry. Let me see if I can turn one of these. Can you hear me now?
It's still echoing.
Jeez. All right.
There you go.
This is better?
Now it echoed again. Sorry.
Oh, all right.
There's like screeching in the volume.
All right. Is this better?
Yes.
Okay. My apology. I'm still an echo. Hello?
Yes.
So yeah, we have a transitional jobs program. So we basically are able to assist individuals that are in need of employment, and we are supported by the state of Wisconsin, and basically subsidize jobs for individuals that are basically haven't had luck in the job arena. And Connor Winners would be the point of contact for that particular program. All right. So I am going to stop because I've been talking for a while and take any questions.
Are there any questions, or is there anything you guys want to hear more about? You're on mute. Are there any questions? All right. Well, thank you for joining us. And is it okay if we send this information out?
Yes.
Okay, I'll go ahead and send the information out then.
Okay.
All right. Thank you so much for joining us. And definitely I'll be reaching out because we usually do this about every 3 to 6 months or so. So it's just definitely valuable information for everybody to get.
All right.
Thank you.
Oh, thank you.
Bye-bye.
Bye.
All right, so you have until 12:15. So go ahead and take care of yourselves, get up and stretch. We're coming close to the end, so definitely appreciate your guys' patience. And if you have any specific questions for me, you can definitely go ahead and unmute yourself if you'd like. I'm still here if you have any questions for me. And that's about it for right now. So we'll be back at 12:15. Annika? Or Jill? Michelle?
Hey Maria, this is Annika.
Can you see, I'm trying to send, did you see the CA programs attachment that I sent?
Let me check my inbox. Hold on 1 second.
Oh, Michelle says she sees it. Okay. It's in the chat. I'm trying to get some stuff to send through the chat and some of it's not coming through. Do you guys see the grab and go flyer?
In the inbox or in the chat?
In the chat.
In the chat, let me just open up what I just saw come through.
Oh, Michelle says
No, that's the community advocates. I haven't seen.
Okay,
Well, let me
check
scroll
that.
up. I don't see the grab and go either, unless you sent it earlier and then I.
Let me see. I'm gonna try to send it again. You know what's interesting is I sent this out in the management meeting on Wednesday, and
Yeah.
it's telling me that I've already like uploaded it to Teams. So it's trying to tell me like either I need to replace it, but it's the same exact flyer, and I'm just trying to send it to this group.
I wonder, so sometimes I have found that if I'm in, I forget to click on the chat that's actually in the meeting that I'm in, and not the chat that's on the like left-hand side or wherever chat normally lives. Let me see if I can.
It's so weird.
Let me see if I can do it. Of course, I can see your, I can see the flyer in the management meeting, but now I can't grab it for whatever reason. Usually it lets you, oh, here we go. Maybe this is it.
If that doesn't work, I think I'm just gonna rename it and then see what I can
Okay,
see here.
I just downloaded it from the management meeting. Let me see if I can just, sometimes it's just maybe another user doing it or something, some sort of.
It says it's sending, but it's not really going anywhere.
I know, I see it. I see it trying to send. Let me try that again.
Yeah, it says failed to send. I don't know what's going on.
Maybe it's too big? No, I can't imagine that it's too big.
No. So weird. You know what? I wonder. Let's get this.
Here we go. What about that? Did that go through? Can you see that? I didn't name it anything. It just says, it's just an attachment. Oh no, never mind.
I don't see it yet.
No, I think it's going to give me the same message in a second. Oh.
Here, let's try that.
Ah, there
You
you
see
go.
that? Okay, so I had to
do.
use the scissors. I had to use the scissors to get it in there. That's ridiculous.
Did you have to take, so you had to take a snapshot of the thing? Maybe it was too heavy. Usually it says something like file too big or something like that, but no, that worked.
Well, this is interesting.
And I can open it and everything. So.
You know what I see Kane did? They put August, September, October, and November all in one. So that's probably why it's too big.
Yeah, it didn't it was maybe too many things. Okay.
Thank you.
Yeah, this is going great. I feel very informed by all of this, so I'm glad that this is happening. Even if we're a quiet bunch.
Well, I'm glad because, usually when they're in person, it's more, they don't spend the whole day with me, but it's just nice that they're actually interacting with other people and they're seeing
Yeah.
everything. It kind of is what it is just because, we're not in person.
No, and I think, I mean, the information transfer is still going really well, and I think everybody who's presented so far has been super informative. So yeah, even if it's not in the ideal setting of everybody being able to interact with each other physically, it's still, I think, pretty good. Of course, I've never done it the other way, so for me, this is perfectly fine.
I think the other way is just way more fun. Like,
Yes, probably. Yes.
I give you time to go and have lunch with the people that you're working with. You guys get to, figure out, like, besides what I give you to do, then you go out and find one or two resources in the community that you're driving around in, just
Yeah.
all those little pieces that you can experience in the community.
Absolutely. And I agree that it's funny. I was just thinking of, there was a program that recently on Facebook prompted a scavenger hunt. I can't remember. It might have been Black Milwaukee or the Black Business Caucus, or somebody had done a thing that just made me think of that. Like, go out and find, certain things and mark it off and then take pictures of it or whatever. But yeah, so one day we'll be back in the community and we can just all interact that way.
Yeah, I can't wait. Oh my goodness. Damon should be here shortly.
All right, I'm going to put myself back on mute.
Okay. All right, so I hope everybody's back. Our next presenter was from Owens Place, and unfortunately, they're kind of tied up right now. Not literally, but you know what I mean. So sometimes this happens in our work, right? And we just go ahead and we make accommodations and we move things around to make them work. So I am going to present to you as I would anybody else in the community. Owens Place is our community-based drop-in center, so it is underneath the wraparound umbrella as far as being part of our system of care. How many of you have been to Owens Place? Yeah, let's use that. Let's raise our hands. How many of you have been to Owens Place so far? Okay. Who wants to share what they've seen down there? You can unmute yourself and let us know what you've experienced down at Owens Place. This is a shy group. All right. So I won't put anybody on the spot, but some of the wonderful things that have been going on down at Owens Place. Owens Place has been in its current location since about 2013.
I can share.
Oh, go ahead, please.
When I went to Owens Place, I saw that there were several different agencies utilizing Owens Place, such as St. Charles, St. A's, and I think it was Running Rebels, a variety of different agencies that were visiting the location. There were group projects that everyone participated in, even though they were from a different agency. For example, this particular day was a paint day, so they provided pizza for the entire group. And I would think that there were at least 50 children there, and from different agencies throughout, and everyone participated in this paint. So you got to paint pictures or draw art or a variety of things. So it was a group project that everybody participated in, but no one planned it. It was just a come together activity.
So there are many different activities that Owens Place does play host to, as well as collaborate with a number of different community agencies like Safe and Sound, our different care coordination agencies, as you mentioned, Brenda, as well as, you know, just a number of different partners. So whether it's a job fair, a different resource fair, our numerous grab and goes over the summer, we just, you know, it's just a great opportunity to get young adults involved in the work that we're doing, as well as be a support to them. So an individual may come in the door, such as today, and there might be a need. And Nate and Damon pretty much just drop what they're doing and assist that young person. Just because we don't know what it is that they're coming with, you know, we have to be prepared for a number of different things. I'm going to show you guys a video of this awesome job fair that went on back in 2018. And this is just something that Nate and Damon have continued to move with. They've had job fairs ever since this one and prior. So really getting the young people down there, and really the census for Owens Place has grown. Keeping in mind that if you have younger children, you might have to look at the calendar that comes out for Owens Place, which is on their website, as well as they can send that to you on a monthly basis. I do believe it goes out to all the care coordinators, but if you're not receiving it, reaching out to Owens Place to get on that list. Because there are different events that happen on a daily basis, as well as the hours and where they might be and things like that. And it would also let you know like what those events are and if there's anything appropriate for children under the age of 16. So they are aimed at that 16 to 24 year range, but there are times where they have other events too. So let me know if you can see this. Can you see that?
Yes, but we can't hear.
Oh, thank you. Thank you. Hold on.
Owens Place is a community resource center built for young adults, typically the ages 16 to 24. Here we provide life skills and resources to help them succeed out in the community and in their daily life. Because we open to the community, we see an array, a plethora of individuals. But because we also are tied directly with BHD and wraparound, we see individuals that come in here with small or major mental health issues. What we have to do is give these young individuals opportunities to be engaged.
Job search. That's a big thing here in Milwaukee. If you come in here looking for employment, like there's mentors that'll push you to like actually do the application and go through the process.
I'm here as a mentor. I'm here as a shoulder. I'm here as a big brother. I'm here as a father if it need be. But it continuously gaining and building a library of resources that we can again empower these individuals with.
Owens Place is the place to go to try to find a job to get your pocket right.
This is not just a resource fair for the young adults 16 to 24, but it's for the community.
So yes, we have individuals who we work with, and I'm sure you can probably tell, which is the biggest line that came out of that video that we did was to come down to Owens Place and get your pocket right. So we had a lot of fun with that video, and the young man who helped us with that also did as well. So it was really cool video to put out there, and that job fair had tons and tons of people that came and attended, and we had lines going down Fond du Lac. So it was a really great event and really put Owens Place on the map for some of the community stuff that they are doing. So that was really cool to be a part of. We don't want to watch that. Hold on.
Owens Place is a community resource
Sorry,
center built for
technical
young adults,
difficulties.
typically the ages 16 to 24. Here we provide life.
Okay. So some of the events that have been going on throughout the summer, specifically starting in like May, it has been the grab and goes. So definitely letting your families know that, you know, the resources are out here. The last time for October, we had pretty much like a large free yard sale with a number of different resources, clothing, shoes, games, art supplies, a number of different things. This is free. And families can bring their, you know, their friends, their family members, whoever. It is open to the community. So definitely getting the information out to families is important. If like just the parent wants to come, they can come and pick up for their kids. We aren't going to make someone, you know, go home and get their kids, you know, in the middle of a pandemic. You know, we understand that families may just come as that single adult or whoever to pick up for that family. You guys can come and pick up as well for your families. I know some agencies are seeing families in person. Some may be doing porch drops. That's fine. So definitely we hope to see you out there on November 4th. Depending on the weather, it may be on the side of the building, which is where we have been holding them, or we might do them on the inside of the building. So it just depends on what's going on, keeping in mind with social distancing and all those good pieces. Families and young adults. So if young adults are interested in participating with Owens Place, I would say at this point, just have them give a call and do an appointment, just because they have to be mindful of how many people are in the building, but they are still servicing young adults within the building. So definitely, if you haven't been down there, get down there and see what they have going on. They have a ton of stuff. So definitely keep that on your agenda. If you are bringing a young adult to Owens Place, great. If you are mentioning it as a resource, I would definitely, you know, set up an appointment with that young adult to go down there together or meet them or however, because once again, with all the resources, you want to make sure that you're making a positive connection. And with Owens Place, that could be a long-lasting connection because they are available to youth outside of wraparound. And keeping in mind, like, yes, we do service youth up to 23, but if you're working with an 18-year-old that's like, I'm not doing any programming after this, Owens Place would be a great resource to have after us and building that connection. And Nate and Damon really do connect with the young individuals that come through the doors. So definitely keeping that in mind. I sent it to you in the chat, and this should go out to all care coordinators if it hasn't gone out already. Any questions on resources that we covered today or anything else that you would like to see? Did anyone learn anything today? What did you guys learn today?
I was really interested in the diverse and resilient presentation, just because that was an agency or a program that I had never heard of before. So it was really interesting to learn about all the stuff that they do, especially for our LGBTQ youth. So I thought that was really, really interesting.
Okay, thank you. Are there resources that you thought maybe you didn't need to see, or some other resources that you thought you could benefit more from?
Can you hear me?
Yes.
I really appreciated the energy assistance program because I always thought that they only offer energy assistance and that's it. I didn't know that they have a lot of other stuff that they offer, such as the furnace repair and replacement, weatherization program. So I really appreciate that, learning about those programs as well.
Thank you. How would you guys use these resources with families? Would you guys tell families just to show up at the door?
I think I wouldn't just tell the families to show up at the door. At the presentations, there was a lot of people who presented and showed the names and email for or phone numbers for the people that, like, the right people to contact. Because, like, if I just send a client or a family to community advocates, they will just be lost because they have a lot of programs and they have a lot of things that they're offering. So I think if I refer a family to community advocates, I will make sure that I find the right person for them to contact, not just sending them to the agency.
Perfect. Thank you. I love your accent, by the way.
Thanks.
All right. So the gift of time is always wonderful, especially on a Friday. So I appreciate all of you guys coming. And if you have any additional feedback, you can always email me or, pass it through Julie, or any feedback or however. You know what? I'm not really sure. Do you guys usually do a like an exit? I forgot what they call it. What is that called? When you guys rate the class, like you rate the module. Yes, thank you. Where do you guys usually get those? Julie will send it to you. Okay, perfect. All right. Well, you have the gift of time. And so it sounds like this one is going to go on the YouTube channel. So wherever Julie usually posts them, that's where it's going to go. So please feel free to, if any of your coworkers are interested, it's something that you could honestly, if it's on YouTube, you can just go to the section that you want it. So that'll be great. So you guys have a great Friday.
Thank you.
You're welcome.